Kevin getting you in trouble again.
But now? All right, as I was saying, I'd like to call to order the St. Lawrence County Services Committee for March 21st, 2022. Entertain a motion to approve the agenda by Mr. Perkins, seconded by Mr. Smith. All in favor? Aye. Opposed? Carried. I would entertain a motion to approve the minutes of the February 14th meeting. By Mr. Denisha, seconded by, excuse me, Ms. Curran. Any discussion? All in favor? Aye. Opposed? Carried. We'll start the evening off with James Button from Citizens Advocates, and he's going to give us a short presentation. Jim, welcome.
Thank you, Mr. Chairman. Can folks hear me?
Yes.
Okay, great. I'm going to try to share my screen.
Go ahead, Jim. You have the floor.
Great. I'm just sharing my screen. I hope folks can see it. Okay, wonderful. My name is James Button. I work for Citizen Advocates. I wanted to share a little with the Board of Legislators tonight about our exciting and momentous project in Ogdensburg. I have 4 slides. It'll take me a couple of minutes and then I'll answer a few questions. From time to time, Citizen Advocates comes and presents to the St. Lawrence County Board of Legislators, and I think that it's been just over 2 years since the last time we met with folks in St. Lawrence County. Since then, many things have changed at Citizen Advocates, so we always like to start our presentations out with an agency snapshot. So for those of you who are unfamiliar with Citizen Advocates, we are a rural health and human services company specializing in behavioral health, housing, and services for people with intellectual disabilities. We serve a 6-county region, and largely what we say is our catchment area spans from Watertown to Plattsburgh and all parts in between. We have 125 different clinical and social services programs, and we serve roughly about 8,000 to 8,500 individuals in the North Country each year. We have an annual operating budget of 50+ million. We have 850 employees, and we coordinate with multiple state agencies. When you look at that by the numbers, that kind of gives you a picture, but we also like to show a snapshot of the locations that we serve. In seeing the map on the screen, you will note that the yellow stars indicate already established programs and areas that we serve. The red star in Malone is where we're headquartered. And then the blue stars in Ogdensburg and Watertown are what we call emerging markets. So what does Citizen Advocates try to do? If you look at the bottom left hand of your screen, our goal is really threefold. We want to provide meaningful outcomes. We want to lower the per capita costs for Medicaid beneficiaries, and we want to do this without taking state aid. We try to run profitable programs, so we don't need deficit funding, and we don't need state or any type of support to continue to provide those services. We really feel like that's our value proposition, and that's what makes us unique. So behavioral health urgent care, I know it's been in the paper, it's been in the news, and it's something that we're really excited about, but what is a behavioral health urgent care? I think this slide pretty much sums it up, but again, I'm happy to take questions from the audience after I get done with the presentation. A behavioral health urgent care offers services for people who are in mental health or addictions needs 24/7, 365. We're open every day of the week, every hour of the day. Who is on our team? Who might you see if you come into one of our locations? Well, you might see a psychiatrist, one nurse practitioner, social workers, therapists, nursing care managers, even transportation supervisors and supported employment coordinators. We try to wrap services around folks. When I tell people what our urgent cares do, I say, for folks who per se are not familiar with the industry or the work we're doing, I say Citizen Advocates is really committed to quality clinical care, but then we will wrap all types of services and supports around people because we recognize that people's journey to wellness starts in a clinic, but most of their ability to sustain their outcomes happens in the community. So we want to wrap services around people anytime they come into one of our clinics or our urgent care centers. We offer crisis support, stabilization, respite, and detox. And we serve folks young and old throughout the lifespan. After 2 years of planning, we're excited to say that we do anticipate opening the behavioral health urgent care in Ogdensburg on Monday, April 4th. Now, I recognize this is a Board of Legislators meeting evening, and I apologize for the oversight. It's difficult coordinating so many stakeholders from across the state and throughout from Syracuse and Albany, but this seemed like the date that most people could attend. Although if folks are there early or attending the Board of Legislators meeting via Zoom, we do hope that you'll take an opportunity to stop by because we're going to have a ribbon cutting ceremony, guided tours, refreshments, and we're excited to show folks our new location. For those of you who are not familiar with where we're located in Ogdensburg, we're at the end of Park Street, right next door to the Tractor Supply. It's the former Agway supermarket or Agway department store. Citizen Advocates tries to look for win-wins in every community we serve. In Messina, we took over an old bank that had gone unused for a couple of years, and we renovated it into a clinic. In Ogdensburg, we're renovating. We've renovated an Agway, and it looks completely different. And in Watertown, we just bought a supermarket that was not being used, and we're going to renovate that as well. So that's really what I have in terms of a presentation tonight. I'll take questions.
I don't see any. Thank you very much, Jim, for showing up. Anything else? Mr. Wait a minute. Mr. Reagan has a question.
I just want to, as a legislator who represents the area where you're opening the clinic, I just want to thank you for bringing this new service into Ogdensburg. You know, there are people in need. There are people with addictions. There are families that are looking for help for their loved ones. There are people who sometimes don't know where to turn. And, you know, I think that having this urgent care center, having a place where 24 hours a day, people with addictions can come in and talk to your people and try to get the help they need is extremely important, because when someone realizes that they need help with their addiction, when they decide that they want to reach out for help, I think it's extremely important that on a 24-hour basis, there be a place where they can just show up and seek help and, you know, have someone there who wants to work with them. And I think this is extremely important in this day and age when we see many people of all walks of life who, for one reason or another, have you know, become addicted to various substances. And since we all know that many people who do have addictions, it takes numerous times, so often before they get into recovery and stay in recovery. That services like, what you're bringing to town are important. Now, one question I have is, people who are having overdoses. Some people ask me, will the rescue squad take them to the ER, or will they take them to your urgent care center?
Well, thank you, Mr. Reagan, for your comments. We're grateful to be in a position to serve the Ogdensburg community. When you think about citizen advocates programming, a large swath of it are in communities that desperately need our services and support. We're North Country people who are committed to helping the North Country. So we're excited about Ogdensburg. We're grateful to be in Messina. We opened in Messina in 2019 with the support of the St. Lawrence County CSB. And we've already outgrown 2 different buildings in the process. And in fact, we serve over 1,200 people annually in Messina alone. Having opened a clinic in less than 3 years and serving 1,200 people tells us there's a significant need, and we need to continue to provide additional services. With regard to managing medical treatments from folks who call 911 and rescue squad, that's a complicated situation and a complicated answer. So I'll try to do my best. If folks call 911 and are in a medical emergency, they are required to be taken to the hospital emergency room. However, most folks and many folks who know this service is available, and it will take time for this to saturate the community, will oftentimes get themselves to the urgent care center. But the urgent care center is just like an urgent care center that you would go to for physical health, for a bump, bruise, cough, cold, maybe a flu shot, but just for behavioral health and addictions. So rescue squad won't necessarily bring someone to a primary care urgent center, and rescue squad won't necessarily bring them to the behavioral health urgent center.
Well said.
Thank you.
Okay. Anybody else?
Thank you.
I think we're all straight. I hope that you would come back, Jim, and let us know how you're doing a few months down the road, and give us an idea of what you're seeing as far as the types of folks that are coming in there and what their needs are, and maybe some numbers. So,
Sure.
Thank you for showing up. Thank you for sharing with us. And next time, do this on a Tuesday night, okay?
Okay, perfect. Thank you all. We're really grateful
Thank you
for
very
your
much.
support. And we're grateful for St. Lawrence County. Have a great night.
Good night. Okay. Moving along, just to note that legislators Burke and Fiaco are excused from this evening's meeting. And we will move on to community service, and Jay Ulrich with the first resolution modifying the 2022 budget for community services for funding from New York State Office of Mental Health Workforce Grant. There's a motion by Mr. Smithers, seconded by Mr. Forsythe. Go ahead, Jay.
All right, thank you and good evening. So we applied for and received a grant from OMH for workforce grant. We could use this for sign-on bonuses, retention bonuses, but we opted to use this like we did on the addiction side for training for our staff. So this resolution allows us to have a number of trainings done in a self-directed format that could be done after hours, and then the staff would be reimbursed for that training rather than have them doing trainings during the daytime billable hours, because as you know, we are short on staff. So it's $24,000 for training from OMH.
Any questions or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution is modifying the 2022 budget for community services for North Country Initiative and Promise Practices Funds. Moved by Mr. Denisha, seconded by Mr. Smithers and Ms. Curran. Go ahead, Jay.
This grant was given to us last year by NCI, and we used it for reality therapy goggles. And when we purchased these goggles, they were out of Europe, so there was an exchange rate to our favor that allowed us to have more money than we anticipated. So this resolution represents a change so that we can use the remaining funds of this grant for advertising.
Questions or comments? Seeing none, all in favor? Aye. Opposed? Carried. The next resolution is modifying the 2022 budget for community services for comprehensive opioid stimulant and substance abuse site-based program funds. Moved by Ms. Curran, seconded by Mr. Smithers. Go ahead, Jay.
Okay, so this is one of two grants that are, or excuse me, two resolutions that are kind of sister resolutions. This first one is really a chart of accounts that we created for the opioid treatment program. And the monies that are represented in this resolution are strictly from the COSSUP grant. We do have some projected revenues, and there's also some staffing that are not included in this once we move towards opening it. But this $243,500 will be used from the COSSUP grant to open the opioid treatment program. So currently we have a total of $419,783 for the St. Lawrence County Opioid Treatment Program. That number is up from $406,000 because of the lag in getting the grant started and so forth. So the first year, we anticipate spending this amount, and then in year two, we anticipate spending $176,283.
Questions or discussion? Seeing none, all in favor? Aye. Aye. Opposed? Carried. The next resolution is modifying the 2022 community services budget for COSSAT funding from the Office of Justice Programs. Moved by Ms. Curran, seconded by Mr. Smithers and Mr. Perkins. Go ahead, Dave.
So on the previous resolution, it was a A14 org in Munis, our financial platform. This is A15, and we've had that to record the COSSUP opioid grant funding. So this is really kind of a reconciliation and bringing these numbers more to actuals based on the fact that there was a delay in starting the payroll for the fiscal manager. There was also a differential with regarding fringe, and then the subawardees, that being the Grace House and Seaway Valley, there was a lag there, again, due to the late start. So these reflect more accurate numbers in our A15 budget for the COSSUP grant.
Any questions? See that all? Did you have something else there?
No.
Okay. All in favor? Aye. Opposed? Carried. The next resolution is modifying the 2022 budget for community services for Epic Health Solutions LLC for improvements to billing practices. Moved by Ms. Curran, seconded by Mr. Forsythe. Okay,
So there was a resolution last year that was passed or adopted to allow us to spend $8,000 for Epic Health Solutions to provide consultation and training services as we move towards the new EHR and taking back the billing. So we were unable to expend that money last year, so we're simply trying to put that $8,000 into the 2022 budget. So thus far this year, Epic has provided OMH Medicaid billing training, Oasis Medicaid billing training, and then tomorrow there's a scheduled OTP billing training. So we did not get invoiced in 2021.
any questions or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. The next resolution,
Nicole has a question.
who does?
Nicole had her, Mr. Terminal.
Ms. Sherman, you have a question?
No, I was just voting yes.
Okay, thank you. The next resolution is accepting a donation from Seaway Valley Prevention Council for community services addiction services. Moved by Mr. Smithers, seconded by Ms. Curran. Okay,
There was a community meeting, I believe it was Northern Tier Providers meeting, that Seaway Valley announced that they had some extra furniture in the 4th floor of 206 Ford Street that they were not planning to use. And that furniture was purchased using Oasis funding. So in order for them to donate that furniture, it would have to be another Oasis provider. So our program director went to 206 Ford, looked at the furniture, and felt like we could use some of the furniture that was not being used by Seaway Valley. I think there's like 3 desks, 1 table, and then there's some standing frames for computers if you don't want to sit during the day, but would rather stand while you're using your keyboard and your screen.
any questions? Or comments? Seeing none, all in favor? Opposed? Carried. The next resolution is modifying the 2021 budget for community services for funding from RFMH Oasis New York State Opioid Response Grant. Moved by Mr. Smithers, seconded by Ms. Green. Go ahead, Jay.
So this is what we call the Store One grant. The subsequent grant, which we still have open because that's still for the mobile clinic, but this grant has been closed out. So these numbers here represent the actuals that we'd like to modify the budget to in order to close out the grant and move forward.
Any questions? Seeing none, all in favor? Opposed? Carried. Can you update us on the clinics, Jay?
Sure. There was a little bit of decrease in the no-show rate for addiction services and a little bit of an increase for mental health this month of February, but the aggregate was slightly lower. Overall for this month, the numbers were slightly improved. Again, there's a lot of ebb and flow, and a lot of variables that affect our numbers. Anywhere from clinicians taking time off sick, COVID, no shows, cancellations by clients. But in any event, we did increase. So for instance, the addiction services was up from 4.9 for the average counselor visits of last month to 5.35. The addiction service weighted face-to-face was up 68.1% as compared to last month, which was 63.6%. Some of that may be able to be attributed to the lower no-show rate for the month. It's difficult to tell. Mental health also increased. Last month it was 75.2. The prior month was 73.1. And for February, it was 78% of face-to-face billable hours. So the prescriber visits, my cat. I'm sorry. The prescriber visits were pretty much the same with the exception of the mental health prescriber that went down from 9.3 last month to 7.22 this month. There's been quite a few people that have been discharged from medication management services, so that could account for some of it. But there's work to be done there for sure. The mental health waiting list is actually currently 72, not 84. We did assign, about 10 clients to therapists. So today was the first day that we had a new mental health client that transferred from the chemical dependency, the addictions treatment services, transferred over to mental health. So we're orienting her to, that electronic portion of that, the portion of the electronic health record that corresponds with mental health. We're trying to get her trained, and we're going to try to focus on this wait list and incorporating that into her caseload. The 18 individuals that are on the wait list for addiction services, again, we defined that wait list as there being greater than 5 business days out is considered to be on a wait list per OASIS, but those 18 individuals are scheduled. There are some that are 3 weeks out, but they are scheduled. With regard to individuals served, it was down a little bit this month, both on the services provided and those served. And then the billing's, fairly consistent. We're averaging around 90% of paid of what we bill for. And I know there was a question that was previously asked in terms of why do we bill for 98% and only receive 91%? The 91% in this case for this month really represents several months of billing. So when we bill, they all don't come in at the same time. So the first column represents what we have billed that month. The second column represents what we received, not necessarily from that month's number of services, but it could go back as far as 3 months, based on the payer. But on average, we do average around 90% rather than 100% of getting paid for services. And again, that has to do with denials, has to do with self-pay and things like that. So, but I mean, that kind of was the target, moving forward once we allowed IMA to take over the billing several years back. So. I don't know if there's any questions or.
Mr. Perkins has a question.
Thank you. Jay, on the billing, like you say, there's 91%. It goes down to 87%, it's kind of an average. If we putting this epic billing in, this resolution we just did, how much is that going to increase that percentage wise?
That's hard to tell. There's going to be a learning curve here when we eventually get away from paying our current vendor, EHR vendor IMA, to do our billing. So part of this is being prepared for that, I guess, a little bit of an existential leap, moving from having IMA do it to having done in-house. So we're hoping over time, the goal is over time that's going to happen. But to what level and what percentage, I do not know.
Okay. You mentioned that these percentages that were being paid are split up over numerous months possibly. Do you keep track of what months they're supposed to be in so that we know in that month what the percentages are we're getting? I mean, I guess I'd like to see apples to apples.
Well, I mean, it's really hard to see apples to apples because, you know, we get the billing batches out, but it really depends on when the payer ends up sending the remittances, you know, back to the county. You know, different payers have different time periods in which to pay. And they also have different time periods in which we have to be able to submit time and fashion. So like Medicaid, you have to submit now within 90 days. So, I mean, that's not typically been a problem in terms of the time frame getting the batches out. But in terms of getting the remittances back, it's really hard to know. In terms of being able to track, you know, month to month, I mean, I could ask and see if that's possible to actually get those monthly numbers. But it, you know, again, it would be a little bit fragmented because, you know, if we bill for 98% of services in February, then there's only going to be a smaller portion of that we're going to get back in that same month. Rather, most of that will probably come back in subsequent months.
Okay, thank you.
So, anyone else? Seeing none? Jay, thank you very much.
All right, thank you.
Move along to public health and Jolene Munger. And the first resolution is authorizing an increase in rates for the Public Health Department Medical Director. Is there a motion by Mr. Denisha, seconded by Mr. Perkins and Mr. Forsythe? Jolene, go ahead.
Thank you. So this resolution would be to change the rate of our medical director from $5,000 annually that was set in 2009 to $10,000 annually due to the increase in work duties and not having any salary change to keep up with current salary since in 13 years. And last month I spoke about the increases that the medical director has been taking on.
Any questions or comments? Seeing none, all in favor?
Aye.
Aye. Opposed? Carried. The next resolution is authorizing the chair to sign a request for revocable permit with SUNY Potsdam for a Bridges Out of Poverty training. Moved by Mr. Perkins, seconded by Mr. Smithers. Louise?
Thank you. So this is a Bridges Out of Poverty training. Is a training we would like to provide out of our opioid epidemic grant funding. And we are looking to host it at SUNY Potsdam for a couple of reasons. One is due to the size of the classrooms, so we can still have a larger number of people attend while still having some social distancing available for staff or for people that attend. And two, to try to offer the class not only for central location and so county employees can also attend, but so we can get some of the students there more prepared to come when they're graduating with the training that is especially necessary in our county. So we're looking to host this training specifically at SUNY Potsdam with the thought to move around to other locations in the future.
Mr. Smithers?
Jolene, is this figure correct that the cost for the county is $175? That's it?
So that's what the cost for the space for the day would be, yes. And that is covered under our grant.
Good. Anyone else? Seeing none, all in favor?
Aye.
Opposed? Carried. The next is approval of rates for related services for the preschool special education program. Moved by Mr. Denisha, second by Mr. Akers. Jolene, go ahead.
Thank you. So this is to set our rates for our preschool program for the upcoming year from July 1st, 2020 through June 30th, 2023. There are no changes to the rates from last year for this year.
Any questions? Seeing none, all in favor?
Aye.
Opposed? Carried. The next is authorizing the chair to sign a contract with Samaritan Medical Center for morgue and laboratory services. Moved by Mr. Perkins, seconded by Ms. Curran and Mr. Smithers. Jolene?
Thank you. So we are looking to contract with Samaritan Medical Center for one of our pathologists who previously has traveled to our county, but given new circumstances for the pathologist to continue performing autopsies for us, we would like to be able to transport the cases to Samaritan and be able to use our current pathologist instead of sending them all of our cases down to Broome County.
Any questions? Seeing none, all in favor?
Aye.
Opposed? Carried. Next is authorizing the chair to sign contracts for services for the preschool special education program. Moved by Ms. Curran, seconded by Mr. Forsythe. Jolene?
Thank you. So this is to authorize the chair to sign all of our preschool education contracts for our center-based programs, special education, itinerant teacher, evaluation at the rates that are set by the New York State Education Department, and the related services at the rates that were just set by the county. And this is for that the same period, July 1st, 2022 through June 30th, 2023.
Any questions? Jolene, I have one. Exactly what service do they provide? What do they do?
For the preschool?
Yes.
Okay. So preschool, the county, we provide the transportation. We're the fiscal responsibility for that. And then the schools provide different services. So it's different from your universal pre-K. There are different classes depending on what type of disability or mental health that they might need. So there are classes throughout the county. So I know like Potsdam has a class, Canton has a class, Messina, Ogdensburg, and I believe Governor. So our students are bused depending on what class, and the parents have a choice in that class. And not every class caters to the same needs. So there are different services that help to more prepare the kids and ready them and give them the attention that they require until they can get into the special classes at the K-12 level.
Thank you. Any other questions? Mr. Perkins?
Thank you. Jolene, this is something that the state requires us to do, isn't it? A mandate?
So it's a two-part thing. So we're currently the fiduciary part of that. I know NISAC just put forth a resolution to try to get counties out of that, and that just passed, I believe. And on the other side of it, the schools are responsible for the classrooms, the portion of it, and providing the teachers and education. Not all of our county students bus and go to classes within our county. We have some students that, depending on where they live, it might be closer for them to go to, say, Tupper Lake or someplace in Jefferson County, for just depending on where the geographical location is. But it is a current requirement for the counties to provide the transportation, and we pay the programs as part of that. So the invoicing comes to us. And then we bill the state, and then once we get reimbursed, we send that back to the schools or the providers.
Anyone else? Seeing none, all in favor?
Aye.
Opposed? Carried. The next is proclaiming April 4th through 10th, 2022 as National Public Health Week. Moved by Ms. Curran, seconded by Mr. Akers and Mr. Spay. Doreen?
Thank you. So National Public Health Week this year is the April 4th through the 10th. And it highlights all of the different challenges that public health goes through, especially in rural communities such as ours. So during this week, we will be putting out a press release every day. There is a different theme. So we will be doing different postings on Facebook about what it means to us or to the county education for each day.
Any questions or comments? Seeing none, all in favor?
Aye.
Opposed? Carried. Doreen, thank you very much.
Thank you.
We'll move on to social services, and Heather Rand will be here. The first resolution is proclaiming the month of April as National Child Abuse Prevention Month. Moved by Ms. Curran, seconded by Mr. Denisha. Ms. Rand.
Yes, thank you and good evening. Since 1983, April has been declared Child Abuse Prevention Month. Child abuse and neglect continues to pose serious threats to the children across the country. Children have a fundamental right to be raised in a safe and secure environment that best prepares them for a future of opportunities. Collaboration is essential among community service providers, schools, businesses, and law enforcement to reinforce protective measures that help to ensure the health and well-being of our children. We're hoping to continue to support this important issue by recognizing the month of April as National Child Abuse Prevention Month.
Any discussion? Ms. Curran.
I'd like to be added as a co-sponsor.
So noted. Anyone else? Seeing none, all in favor?
Aye.
Opposed? Carried. Heather, you're going to present these statistics for us?
Yes, I'm hoping that Dylan had some of the last minute changes that we had to send over. So good evening. Tonight, we're going to take a look at social services monthly updates for the month of February. February is the shortest month, so it's not surprising that we saw a slight decrease in the number of child protective referrals that we received. We received 139 compared to 154 for last month. That brought us an additional 320 children compared with 336 for last month. The state and national average percentage for indicated child protective reports is about 15 to 16%. You'll see that so far this year, we're right around 17%, so slightly higher than the average. Notably, there was a decline in the percentage of family assessment response reports for the month of February from 19% to 11%. This could be related to the cases that are eligible for the family assessment response, the need of additional workers to be trained in that response technique. And I would also note that our unfounded cases also increased from an average of 64 to 72%. Looking at the safety assessments that were entered into the New York State Connections system, reviewed and approved online within the 7 days, we had 99%, and that was for the month of January, since the state data is a month behind. One additional note regarding the indication rate. So in looking at the state central registry reform that started in January 1st of this year, that changed our burden of proof to indicate child protective reports from some credible evidence, as we discussed before, to a fair preponderance of the evidence. The SCR reform was established to help bridge gaps in the system because some credible evidence is not a legal standard accepted in family court. The reform is important because it raised standards to help address implicit bias that exists within the system, as demonstrated by minority populations being disproportionately impacted. The higher standards change people's ability to become employed because previously an indication would remain on the registry until the youngest child in that family turned 28. Now an indication remains on the record for 8 years. So in essence, this change helps people move out of poverty. Lastly, the change in the SCR reform could positively impact people's ability to become foster and or adoptive parents. As people move off the registry sooner and fewer people are likely to be indicated due to the higher standards, this would allow for increased opportunity for people who are interested in fostering and or adoption to become certified. To date, the SCR reform has not impacted St. Lawrence County or has not been proven to be a barrier to the adoptions within our county. So I just wanted to note that cases take 60 days to be investigated, and the reform began January 1st. So we're just starting to see some of those cases be closed this month. So as we look at the average caseload for CPS, we had a substantial positive change this past month. Since September of 2021, as you recall, caseloads have remained right around 26 per worker. This past month, we saw a decrease to an average caseload of 22. So we are inching closer to the Office of Children and Family Services standard of 15 investigations per worker. This was accomplished under some unique circumstances that worked together this past month to optimize the outcome. So if we look at our total caseload, we were at 738 for total open cases, and we are down to 638. What we did was we took our trained senior CPS worker, took her off the rotation of regular reports and had her work on the caseloads of 2 workers who had resigned, leaving us with over 50 cases. So she was able to help efficiently and effectively process those cases that had work done on them, but were not complete. Additionally, CPS supervisory staff had attempted to reinstate the week off reports rotation to assist in workers being able to complete documentation and other requirements in order to close their cases. This was implemented partially for supervisors as well. I think they were only able to take advantage of 1, maybe 2 days in the month of February to focus on reviewing cases that had been submitted, providing feedback to the workers and other documentary duties that they have as well. So these practices were very helpful, not always possible due to the instability of staff, the nature of the reports and the numbers of the reports coming in and other barriers that exist. However, we are reviewing the process and hope to possibly be able to continue the momentum to have the senior staff continue to work with caseworkers, for example, that have larger caseloads to help them bring those caseloads down. So if we look at the cases per month by supervisor, I'll make one note in 3856, the first unit, talked about it last month. The first worker actually left us in January, but she had 1 case. So the case closed in February. So that's why you see that 1 individual with no cases, they're actually no longer with us. In unit 4590, again, the worker with a reduction of 14 cases is no longer with us. So that was one of the workers that we were able to help process those cases. Unit 5478, we had 1 worker return from maternity leave. So if you're looking at particularly one of the caseloads that's rather low, that individual is actually one of our senior trainers. We also have another worker in that unit who's been out on long-term medical leave. That's why one of those caseloads is rather low as well. And this unit tends to be the training unit where we bring a lot of the new CPS workers to start going out in the field and work with the other caseworkers that are more experienced. I don't really have any specific notes for unit 6035. 7255, again, I would note the worker that reduced by 23 is no longer with us, as well as 6593 is no longer with us. One of the highlights is that we currently have 5 caseworkers in the training period, 2 that will end their training at the end of April, and the other 3 coming up, I believe, in the 3rd week of March. So this is excellent to have a full training cohort of 5 caseworkers. And again, if you look at the breakdown of the closed cases, it kind of just gives you a visual of the number of cases that some folks were able to close for the month of February. So if we look at the foster care and preventive numbers, the total number of children in the care and custody of St. Lawrence County for February was 309 youth. This is down 2 from January. The numbers in that middle chart kind of look backwards. I think there's supposed to be 6 that were removed from care and 4 that entered. And I think the way they look, yeah, maybe that's right. On my chart, it had a change, and I think mine's reversed from that. But anyway, 6 were removed and 4 entered. So we had a net decrease of 2 youth in care. So if we look at the average number of children in care, we're still staying below that average from 2021, which is what we want to continue to do, is decrease the number of children in care. If we look at the average days that children have been in care, that number unfortunately increased from 741 last month to 753. So in trying to take a deeper dive into the number of days that kids are in care, we're going to start looking at the youth that are freed for adoption without a resource, which tend to be our difficult to place children that are often in residential settings. Try to provide some additional context to that number of 753 days in hopes in developing new strategies to improve outcomes for the kids that are potentially in care the longest. So we hope to provide that data to the board next month. On the next page, if we look at the average number of children receiving in-home services, so the average number decreased by 7. This is an area that we'd actually like to see, as I mentioned, grow and increase with the number of children and families receiving home-based services to prevent out-of-home placement. We've actually been looking at specifically prioritizing one of our preventive workers to work with families that request or need preventive services on a voluntary basis, so without court intervention, but that would really specialize in working with voluntary or families that are with us voluntarily. So if we look at the average cases, again, it stays steady in foster care preventive. Last month it was 11, this month it's 12. If we look at the differences across the units, there really isn't much change, down by 1 or 2. One unit, one worker had an increase of 5, but really not much changing among the workers in a lot of those units. And in unit 3660, that is our adoption unit that specializes in adoption services. So we do have 1 vacancy in that unit. Actually, I didn't mention previously in the first unit 6053 that there's actually a trainee in that unit and a vacant position as well. We currently have 6 vacancies, or excuse me, 2 vacancies in foster care preventive and 6 in CPS. So if we're looking at that unit 3660, that's primarily our adoption cases. And our supervisor, who was an adoption worker, is also continuing to complete her adoption cases. And you see that by her number being represented underneath 3660 with about 6 cases. Home finding unit, these are some of our Ogdensburg staff. They saw no increase in the kinship homes for the month of February and a net decrease of 4 non-kinship homes. We have 1 additional home finder that started this past week, came back from maternity leave, and we have an additional vacancy in that unit as well as we look to recruit and increase our foster homes, including non-kinship homes. Again, another highlight for recruitment, we have 5 staff in the training program for foster care preventive, 4 that will be done mid-April, 1 that will be done at the start of April. We have not had full training groups since positions were originally approved back in May or June of 2021. So this is a huge accomplishment for recruitment. for the department and for caseworkers and caseworker staff. So if we look at cases closed across foster care preventive, there isn't really a whole lot to report. Those cases tend to stay open until court orders expire. And we may look at kind of condensing this graph a little bit because there isn't really a lot to look at there. Adoption activity. Unfortunately, we had 0 adoptions for the month of February. We had an additional 6 children that were freed for adoption in February. So currently, St. Lawrence County has 9 packets that are with the court. We have an additional 4 that will be filed, that were filed today, 6 packets are in the final review at the department and expect to be filed within the next 2 weeks. And we have 3 that we hope to file in the next 4 weeks that are pending a 30-day wait after an appeal. We have 3 adoptions that have been scheduled for the month of March, so later this month. And if we look at our overall summary of our foster care placements and our average foster care placements, Family First state and federal regulations continue to be met by the department. As you recall, in September of 2021, the county needed to be below 8% for our institutional rates, and we're currently at 6%. We had to be above 50% for relative kinship homes. We are at 56%. And I want to note that we did go up from our average on institutional placements. However, each youth has had to have an appropriate assessment by a qualified individual as part of Family First. And each of those placements has to be approved by the court. This helps to ensure the youth is in the correct level of treatment and that residential care is truly warranted and necessary. So if we move on to our eligibility programs, temporary assistance, supplemental nutrition assistance program, medical assistance, and HEAP programs, there really isn't a lot going on as far as numbers changing up and down. One of the things that has been noted is there was an announcement that the Treasury had reallocated $377 million to 4 states that included New York State for the ERAP assistance program, and the states, that money was taken from the states that did not use it. So more details and specifics regarding the benefits to this county will be forthcoming by the state. Regarding HEAP for the 21-22 season, there have been 7,411 regular HEAP benefits, 2,181 emergency benefits, 30 repairs and replacements. And I know we are going to try to look at a timeline for how long some of those repairs and replacements may take. In regards to some medical services updates, St. Lawrence County community Medicaid workers are anticipating a significant amount of recertifications coming up since the state will no longer be recertifying and extending benefits automatically for a year as of July 31st. So this is anticipated to be about 80 recerts per worker or 350 for a unit of 7. The state is transitioning away from their protocols due to COVID and will no longer be doing automatic re-enrollment. So the current staff are preparing for this, noting that the recertification process will be difficult and take away time from some of their current job responsibilities, such as managing the concerns and issues related to medication, billing, coverage, and transportation needs of their clients. Since the state had been electronically extending cases for a year, the needed research will require current budgets, reevaluations, and lots of hands-on work to bring applications current. Additionally, we did have some newer staff that were not in Medicaid long before COVID started, so they may need some additional training to be brought up to speed. The last thing I wanted to note was I had mentioned to the board a couple of times that we wanted to bring you some statistics, some data, some information regarding the employment unit. So we're still kind of working out what data points to bring to you that would be the most beneficial, but I did want to note that in the month of February, The unit had 102 applicants, 582 recipients of services. Regarding individuals who are non-compliant with mandated activity, the unit had a sanction cost savings of $111,624 for the 2021 year. And for the month of January, $6,611. Again, the data is coming from the state, so it's lags about a month behind. In 2021, St. Lawrence County Employment Unit had 95 entries into employment, placed them second in comparison with all small, medium counties in the state, which is a total of 18. Also in 2021, they ranked second out of 58 counties for participation and engagement working with safety net cases of individuals without children. In the same time period, in working with TANF and safety net cases of families with children, St. Lawrence County Employment Unit is in the top 10 statewide for engagement activities out of 58 other districts. So that concludes my data for the department.
Mr. Chairman,
Thank you, sir. Heather, thank you for the report, and it's very, very promising to see that we are going to have 5 new trainees in each area that will be slowly taking cases on. I'm sure that's a great for both of the departments. I'm wondering about the app. I know at one point we had the discussion that many people in St. Lawrence County had applied for those funds, and we hadn't. They weren't successful in getting the rent assistance actually sent in. Can you just provide, if you have an update on that, could you just provide us a status update on whether or not those funds are being sent out to the applicants and how the people in St. Lawrence County are doing getting that support?
Yeah, I attempted to get that most recent report information today. I wasn't able to get that, so I will get that and send that out. As for the amounts that were sent out for St. Lawrence County and applications still pending.
Thank you very much.
anyone else? I don't see anyone else. So Heather, I'd like to thank you very much.
She's
We'll move
not,
along to Mrs. Doyle.
she's not going very far. I'll give you my
I know.
update on the vacancy review, and then our first department up is social services. So our vacancy review committee met on March 8th, as we do the Tuesday following every board meeting, with few exceptions. We saw 9 departments bring forward a total of 12 requests. Out of those, tonight you'll see 3 on this agenda and 4 on the operations committee agenda. And we currently set aside the temporary or seasonal positions, are looking at the beginning of March, about 67 positions that are not full. And that's about a 7.2% vacancy amongst the 839 positions. I don't have the update for you on the fill rate that I typically provide at these, but I will bring that to finance. So that being said, we do have 3 positions for social services. Heather?
Yes, so the first position is a senior employment and training counselor. This position is vacant because the person in this position received a promotion because some who'd been with us for over 30 years. So this position provides support, some supervision, auditing, training, developing new programs, helps as a liaison for policy coordination, and helps to ensure the best use of county resources to provide employment opportunities to folks in the county.
Questions on the employment training counselor? Okay. Social welfare examiner next.
Yes, this is a permanent vacancy in the HEAP unit. And again, this is vacated due to a promotion. The individual that was promoted to another area within the department. And I just provided some of the most recent updates from all of the assistance that the HEAP program provides to the residents of the county.
Questions on the examiner? And the last one, the support investigator.
Yes. So again, this position is vacant due to promotions, due to a retirement. So the support collection unit, this specific position would be a investigator that would work with individuals throughout the county to help with child support collections and potentially attend court proceedings as well.
Any questions on the last one? Investigator?
No.
Okay, thank you, Heather.
Thank you.
Next up, we have one vacancy for public health, and that is our public health nurse. Jolene?
Thank you. So this is due to a resignation. This public health nurse was in charge of our immunization program and our maternal child health and public health detailing. She was also my lead COVID nurse. So we would like to attempt to fill this position once we get some applicants.
Questions on the nurse?
No.
Okay, thank you, Jolene.
Thank you.
And the last one on this agenda is community services, the RPN or RN. Jay?
Yes, this vacancy is due to a promotion. We had the clinic manager, which is a civil service title, but we think of that person more as a nurse manager. But in any event, we promoted that individual from within. She was the director of nursing in two prior places of employment and also a nursing supervisor. So she interviewed and we offered her the job, but it is dependent, or it's dependent on when we're going to be opening the clinic. So we're anticipating her transferring to that nurse clinic manager position the 1st of May. If everything goes well with opening the OTP. So we are asking for an immediate fill because that we can't advertise, or we can advertise, but we can't fill that position until she vacates the other. And as you know, nurses are a scarce commodity. So we are asking for an immediate fill pending her vacating that position around the 1st of May. So this is a mandated position with OASIS. Some of the things that she does is she provides health assessments, pre-provider workup, where she tees up the doctors for MAT medication. She does psychotropic injections, prior authorizations, medication refills, lab reviews, and reports any abnormalities to the prescribers. She refers to medical specialists if there's any problems with their physical health. She does toxicology testing, tracks DEA list for Suboxone, and also participates in the opioid prevention program. So we're asking for an
Questions, clarification on how this is intended to work? Good? Okay. Thank you, Jay.
Thank you.
That concludes vacancy for services.
Thank you, Ruth. We'll go to committee reports, Board of Health, Mr. Akers.
So the Board of Health met last Tuesday night on Zoom, discussion mostly about COVID, also some sanitary cases that were referred to the code individuals for those various towns. Thank you.
Thank you. The CDP Board of Directors, Mr. Sheridan. You're muted, Bill. And invisible. Bill disappeared.
Wrong button.
One moment.
Give him a moment, see if he can be back on.
You coming?
Bill, you shut your camera off. I just prompted you to start the video. If you see that, click on it.
Can you hear you?
I'm not sure.
Bill, can you hear us?
Dylan, have you eliminated?
We'll go.
You can't see.
We'll move on to the Community Services Board, Ms. Haggard.
Good evening. Thank you, Mr. Chair. The Community Services Board met on March 1st. There were 31 attendees. Tonight, I had planned to tell you about the behavioral health urgent care in Augsburg, but I was preempted by the Oracle. So that was a majority. Lori Burke from Citizens Advocates came and told us about that. And our next meeting is on April 5th. Thank you.
Questions?
Mr. Chairman, I'm back on.
Okay. Bill, you want to try it again?
Yes, can you hear me now?
Yes.
Sorry about that, Mr. Chairman. The Head Start program is currently recruiting 3 and 5-year-olds for next year's program for the CDP. They have Head Start classrooms in Potsdam, Canton, Augsburg, Seaman, Governor, Fraser, Harrisville, Norwood, and they also offer home-based programming. And to apply for the program, parents can call the main office at 386-1102. Their housing choice voucher programs received a 5-year grant for their program. And that means that the CDP will continue to administer that program for the next 5 years. Weatherization Program is finishing up their current program year, and they're behind on production due to supply chain issues and COVID isolations and quarantines, but they're working hard to complete that contract. These issues are being experienced across the state, and they're not uncommon. Their neighborhood center days and hours are temporarily reduced at a few locations to allow for staff coverage. Messina and Governor are open Monday and Tuesday from 9 to 3. The Canton and the Potsdam are open Wednesday and Thursday from 8 to 3. And the Augsburg and the Colt and Pierpont, Parisville remain unchanged. The Colt Neighborhood Center does have a new building. They're in the same parking lot as the South Colton Town Hall, but a new building has been built for that center. It opened at the beginning of March. And so all the neighborhood center locations continue to have food pantries and provide emergency assistance for individuals with rent and utilities. And they can also offer assistance for school and employment supplies to individuals. And that's the end of the report, Chairman.
Any questions or comments? Seeing none, thank you, Mr. Sheridan. The next is the Office for the Aging Advisory Board, Mr. Ganesha.
Mr. Chairman, I don't have a report. We haven't had a meeting since my last report, but I do want to, not to diminish the efforts of a great number of other people, but I do want to say a special thanks to the Office for the Aging for all the work that they did in regards to the tower fire in Augsburg. They, I think they went above and beyond. Were there, and they deserve a lot of our gratitude, along with a great number of others.
Thank you. Any questions or comments? The next one is the Youth Advisory Board, Ms. Terminelli.
Thank you, Mr. Chairman. The youth committee portion of the Youth Advisory Board met yesterday. I was astounded. We had 50 people join us on our Zoom meeting, and it was made up of law enforcement officers and some human service agents agencies, as well as our youth committee members. We are launching our St. Lawrence County Teen Sextortion and Suicide Awareness Campaign, very timely this year. So we met in breakout rooms. Each school district has a teen ambassador, with the exception of a few. I'm going to get to that in a minute. Teen ambassadors, as well as a human services agency and a law enforcement agency representative. And they're going to be working over the next couple of months to create a universal presentation template that the youth ambassadors can bring out to their school districts. And they'll be doing some peer-to-peer mentoring and training. This program has a pronged message. The first being that you do not know who you're communicating with on social media, so don't send images or text you don't want shared with others. But then the second part of that is, if something does go wrong, even terribly wrong in social media interactions, that all is not lost, and there's always somebody that you can turn to, family, friends, a trusted adult, somebody to support you. In tandem with this campaign, they'll be accepting art pieces as well as video messaging, and they'll be hosting a competition or contest for that to be judged by some members of the committee, as well as some other human services agency representatives. The entry deadline for that is Friday, May 6th. Anybody that's interested, any youth under the age of 18 that are interested in participating in that can find information on the Youth Advisory Board's social media Facebook page or on the county website. And a really big thank you to the district attorney's office, the sheriff's department, emergency services, and community services for joining in this partnership with the Youth Bureau. Flyers will be going out and distributed to schools this week, actually. I mentioned that there were a couple of gaps that we have to roll out this super, super important campaign. So we have some law enforcement needs in Lisbon, Morristown, and Parishville. And I do know that yesterday afternoon, the sheriff's office was going to be reaching out to see if that was a partnership that they would be willing to take on. And then for human service partnerships, we're still needing a human service representative in Clifton Fine, Madrid, Waddington, Ogdensburg. And then the school districts that still were looking for some teen ambassador representation are Clifton Fine, Edwards, Knox, Hammond, Herman DeKalb, Hewlton, Madrid, Waddington, Lord Norfolk, Ogdensburg, and St. Lawrence Central. So this is a really big campaign, and it's a lot of moving parts and a lot of people really together. Fantastic collaboration. In addition, I have to just give Alexa back some props because the team actually led the entire meeting yesterday, including the breakout rooms, from the minutes, the full agenda, and you would have been impressed to see these kids really run the show. So I wanted to just kudos to them and to her. In addition, the Youth Advisory Board is hosting our second annual Trash Dash, and we're upping the stakes this year because this year we partnered with Reality Check and the Seaway Valley Prevention Council, and there's going to be some weighing done by weights and measures this year. We're separating out addiction trash, so anything that is connected to addiction. And they'll be weighing that to see the percent of the whole, so that Reality Check can gather some data about how much of the trash we find alongside our roads comes from addictive measures. So that is being held at the same 5 locations this year. So we've got Potsdam, Governor on Saturday, April 30th at 9 o'clock. And then Messina, Canton, and Ogdensburg will be Sunday, the 1st of May at 2 p.m. Again, flyers will be distributed this week, so be on the lookout for that. We really encourage anybody to join, families, organizations, anybody to clean up the streets. These are near they're on our county roads and near locations that they're easily accessible. There will be a safety training component as part of it. And I think that's it. Cole Siebels, one of our youth committee members, is going to be offering a virtual workshop on either April 27th or 28th on reducing political polarization. He's doing some role play with the other youth committee members this week to iron the kinks out, and he'll be ready to present to anybody. And again, information will be out to how you can access that training as well. Next meeting is for the Youth Advisory Board is Thursday, March 30th at 3, and our Youth Committee meeting is Sunday, April 10th at 4 p.m.
Any questions? Thank you, Mr. Chairman. I would like to report to you that the committee that the board chairman appointed to meet with the city planner in Ogdensburg will be meeting with the city planner on the 31st of the month at 1 p.m. to hear from her regarding what it is she would like the county to assist the city with. And I believe also that she's going to try and have somebody from their engineering firm, Barton Monjudas, present. So should at least have a roadmap of what they would like to see us help them out with by our board meeting. Questions? No questions. Any old business? Great.
Thank you, Mr. Chair. I just wanted to take this opportunity to, first off, echo Larry Denisha's comments about the Office of the Aging, but also to thank all of the county employees and county agencies that swung into action after the when the fire occurred at Riverview Towers in my district. You know, a lot of people in the county sometimes take for granted what our people do around the county and what our agencies do. But, you know, during this, what was a real mass casualty incident, our agencies came together under the leadership of our county administrative team and did a spectacular job in caring for people who were facing the loss of their homes. You know, a high-rise fire is definitely one of those disasters that we hope never occurs, but it did. And when it did, our emergency services office and our 911 center sprang into action to help coordinate with the officials in the city of Ogdensburg, with the fire department, the police department, to reach out to all the other fire departments around the county to get equipment and personnel there to help with this disaster. You know, those many firefighters and rescue squad folks, you know, in some cases were involved in carrying people down numerous flights of stairs to get them out of the smoke and to the help they needed. Once many of them had arrived at where they're being cared for, our mental health and addiction treatment people were there working with each of them to make sure that their individual needs were met and to help them cope with the terrible experience that they had just undergone. I mean, you can imagine how traumatic it is to be carried down flights after flight of stairs, to be, you know, not know whether your apartment will ever be available to you again. Our people made sure that they had somebody to talk to. You know, our emergency services people worked with them to get their meds and get them, you know, the needs that each of them had. our Office for the Aging, worked with them extensively. Our probation department was helping to pick up things that they needed during their time while they were at Wadhams Hall waiting to be rehoused. Our social services department was involved in helping, Ruth Doyle and her team were there, making sure that all these services were brought together as a cohesive whole. And, I had the opportunity to go over to Wadhams Hall where they were, and to talk to some of the folks. And it was amazing how many good things they had to say about what was a harrowing experience for all of them. And that's, Ruth, I hope that you'll fill in any holes that I left. I'm sure I've left some. When you try to thank everybody involved, you leave out a lot. But I think that we, as the county legislature, should be very proud of the response. And I thank all of you.
Thank you. I'd just like to add to that. I think that the Augsburg Free Academy really showed their stuff over there by providing not only space to take these people when they did come out of the apartments and needed a place to go, but providing a space for them to go to, providing food for them over a number of days, and providing some people to talk to them, like you said. It's not a matter, you had to treat everything. Not only, their need for food, but their need for being able to talk about this. The other one that I'd like to thank is the Diocese of Augsburg for opening up Wadhams Hall. That place is, they do use it. And I will tell you that they ended up having to cancel one of the functions that they had in there to accommodate these people. And had they had difficulty in trying to find a different or additional lodging for these people, the diocese agreed to allow them to stay there to the end of the month. And I would venture to say if they needed more time, they got that too. So there's too many to mention. One of them in my quest to gather signatures that was mentioned a number of times was Matt Denner, our Director of Emergency Services. I'm told this guy's shown. We don't know how lucky we are, I guess, some of the people that work for us. That being said, any other old business?
Under vacancy, I keep bringing it up because nurses, you're never gonna fill these two positions. I don't know how in the world we're gonna fill. Somehow we gotta address it. One is $32 an hour, so there's 26. I don't know what we do. We gotta do something, because otherwise these things are gonna sit there.
Well, I think you're right, these two positions will be vacant next year at this time, if we don't do and aren't able to do something. You want to address that?
Well, I just was going to comment on legislative foresight's comment. I believe if you looked at the vacancy, it's the September 2020 was the last time that public nurse position was filled. So we certainly have a challenge before us, and it is in more and more departments, and not only getting them, but keeping them. So I think, we can look at the initial acquisition or making it attractive to come to work for the county, but we also have to make it worth staying at the county. So I couldn't agree more.
Anyone else with old business? New business, any new business? Mr. Smithers.
One of the town supervisors asked me about the requirement for them to have town court justice. Now, some of these towns are not too populated and they don't have many cases, but still they're required to have town justice. And it's an expense for them. Financially, they have to send most of the money they do collect to the state, and they have spatial requirements. And so the question would be, is this a state requirement? And is there any possibility of shifting some cases to them from other locations, or to utilize services from like a traveling circuit judge so that they could serve more than one township? So
I can tell you what they can do.
Some of those.
Is they can go to the state, I don't know exactly what the step-by-step process is. But they have to go to the state, they can get permission from either the Office of Court Administration or whoever it is who deals with that, to have a judge from another town have the authority to hear cases in, say, an adjoining town or another town. So and it's happened all over the state. That already happens. But they've got to make the request. I guess the township that would own the judge would have to go along with it too. But I think that's a first step. Getting a hold of the Office of Court Administration and telling them, we can't afford this, we want to have a judge from another town do our justice court work in our town also, and it can be done. Anyone else? We have need for executive session for
The other committee would be recommended after operations for appointments at this juncture for services. We'll have it after operations if it's all the same.
Okay. Then if there is no further business for this committee, I don't see any, adjourn.
I would like to call the March 21st Operations Committee meeting to order, please. Can I have a motion to approve the agenda, please? From Mr. Forsythe and Mr. Fay. And a second? Oh, I got one second, sorry. All in favor?
Aye.
Any opposed? I have a motion to approve the minutes, please. Mr. Forsythe and Mr. Perkins. And I have the first resolution, for probation.
We need.
Oh, sorry.
Vote
Oh,
on
I'm
the
sorry. So all in favor of approving the minutes?
Aye.
Any opposed? Sorry about that. Thank you very much. So we'll start with the first resolution, which is from probation, declaring April Sexual Assault Awareness Month. Moved by Mr. Perkins, seconded by Mr. Reagan and Mr. Fay. Is Tim here?
Yes. Right, online.
Oh, there you go. Go ahead.
Hi, everybody. So this is a yearly resolution I bring forward for Renewal House on behalf of Renewal House and the Domestic Violence Task Force. This year, they're continuing the theme of building safe online spaces. They're going to have their normal trainings throughout the month. They're going to set up a table informational booth in the lobby of the courthouse. And again, it's brought on behalf of Renewal House, who's going to focus also on a lot of their services that they provide this year.
Thank you. Does anyone have any questions? Seeing none, all in favor?
Aye.
Any opposed? Motion carries. Secondly, I have a resolution proclaiming Earth Day in St. Lawrence County, moved by Mr. Reagan, seconded by Mr. Denisha.
Wait, there was one other, just information discussion item under probation. You do that one? Electronic home monitoring.
Okay,
There's no document. It's just Tim wants to highlight where we are and kind of raise a couple of concerns, if that's okay.
yes, that's fine. Thank you. Tim, can you give us that update, please?
I can. So this is the 5th year of our electronic home monitoring grant. So at the end of this year, the grant comes to an end. So I just thought I would put the bug out there and start talking about whether the county wants to continue home monitoring at the county's expense, starting at the beginning of next year or not. When we first applied for this grant, it was 3 years before cashless bail started. I never anticipated cashless bail becoming a thing. Our numbers for pretrial have dropped from 2015 from a high of about 681 cases a year. And in 2020, we hit 191 cases. And predominantly, that's what electronic home monitoring was used for, was pretrial cases. So at this point, I'm leaning towards not recommending that we do a home monitoring program at the county's expense. The program right now only has 2 individuals on, and that's strictly scram bracelets. It's not home confinement. It's just basically making sure that the client isn't drinking. Cost for us, if we were to do a program, would be, if it was just strictly scram bracelets, would probably be in the range of about $50,000 a year. If we do home confinement, we're looking at about $150,000 to $200,000 at the county's expense. So at this point, I'm leaning towards not making that recommendation, that we continue unless we see some major changes in cashless bail or something dramatically changes, maybe with sentencings or something of that nature. the grant was pretty successful while we had it, but that was because the state was very flexible and changed our goals and how we collected our monies, how we hit our milestones. We were able to max out the grant the last 2 years. The year before that, we were able to keep a revenue well over what we actually spent. So that year, so in about it started in 2018. We basically, our revenue was $500 over what we actually spent, to last year where we basically profited $100,000 in revenue because we were able to keep our expenses down. We didn't have a lot of on-call and a lot of units being used. So I think the program through a grant when the state was paying for everything was a great idea. And because they were so flexible with cashless payout, it ended up being, where we saved money. But for the county to jump into a home monitoring program now at our expense, I think we would be spending a lot of money that wouldn't be there, I guess. I don't think the numbers would be there. So we would have the cost of stocking our shelves with home monitoring units that probably wouldn't be used. We can always start up a program. We would have to go out to RFP again anyway, get bids, regardless if we started in 2023 or if we waited and did it later down the road when we had a need for it. So at this point, I just wanted to kind of say, program is coming to an end. I wouldn't recommend continuing the program at this point. If I feel there is a need, then I'll come back to the board. But at this time, I think we should just let it run its course.
Does anyone have any questions? Seeing none, thank you very much, Dan.
Thank you.
Okay. Next up is planning, and Mr. Jacobson Quotenhauer is here. I have a resolution proclaiming Earth Day in St. Lawrence County, moved first by Reagan, second by Mr. Perkins. Mr. Quotenhauer, go ahead.
Thank you very much. Good evening. This resolution is to designate April 22nd as Earth Day. This has been done for many years by your board. Earth Day has been around since 1970, and it's something that the EMC has been involved with over the years. This year, the EMC intends to work alongside the Youth Bureau on the trash dash that Legislator Terminelli described earlier, and also to look at a pollinator garden initiative that would help spread pollinators throughout the county.
Does anyone have any questions? Mr. Akers.
Just a comment. I mean, I've been on this board since 2011. I've seen this warm and fuzzy resolution for all these years here, but it's pretty much totally meaningless. I would like to know what the EMC's policy is concerning nuclear energy as an alternative to the solar and the wind that's taking up our tillable land here in St. Lawrence County and in New York State. I forget how many thousands of acres in the state that has taken up. Do you know, Mr. Nation? 500,000 acres here in New York State. And we know by the year 2050 that we're gonna need 100% more food. And we only have about 25% arable land left in the world that we actually can grow this food on. And so here in my neighborhood, there's 200 acres in the Maverick Chipman area that have been used up for solar that was formerly providing forage for either beef cows or dairy, producing proteins. So I'll support the resolution. It's warm and fuzzy. Why not, right? It's apple pie and mom. But I think they need to do a meaningful presentation to the board, actually, about what their intention is, what they support as far as energy policies, as we're trying to eliminate fossil fuels and the impact it is on St. Lawrence County residents.
Thank you, Mr. Akers. Anyone else? Mr. Smithers?
Yeah, I completely agree with Mr. Akers on that. We have a growing, increasing demand for electricity, talking about people buying electric vehicles, and where's all this electricity gonna come from? Certainly solar can provide some, wind can provide some. We have hydropower here, but we do need to explore nuclear power. Nobody's talking much about it. Some countries are doing it. We certainly need to do that more. That's a very clean energy. Technology's improved a lot. The waste has decreased dramatically. There certainly is a need for a speaker that we had 2, 3, 4 weeks ago agreed that we do need to explore nuclear power as a way of providing electricity for this growing demand.
Thank you. Anyone else?
Yeah.
Mr. Lightfoot, go ahead.
And just to comment on Mr. Smithers, that growing demand is in New York City, it isn't upstate. And I think that we ought to be looking at what we're doing to our countryside. I just happened to drive by one here 2 nights ago. I was getting signatures down in Briar Hill. I didn't even know it was there. It probably encompasses about 4 acres, and it's just line after line after line of Chinese-made solar panels. You can't go anywhere now without seeing these things pop up. And the benefit is to the individual, the farmer, which I certainly don't, I begrudge them a benefit because of this. But not a nickel's worth of that power stays in upstate. But, and they're using our land collectively to site these things. And in addition to that, if it isn't that, it's windmills. And I think Kevin's right. Nuclear plants can be built at a fraction of the cost and size that they were back in the day when they were popular. And if we don't do something, we'll end up like Germany, shutting down what we do have and wondering where our fuels are going to come from to generate the electricity that we need.
Yes, Mr. Forsythe.
I had the opportunity to fly across most of this country this last week, and you see the solar panels everywhere along the Midwest. And when you get into Los Angeles, it's just inundated with them. And the biggest problem is the storage, the capacity to store. They can't store. And where we went on vacation, the same thing. It's all solar, few windmills, and they just can't store it enough of that. And the technology's not there yet, I don't believe. So we've got some serious considering to do somewhere. Someone does.
Mr. Denisha.
I am encouraged to hear my legislators speak about this, because I've brought it up a number of times, talked about the acreage that we've lost in New York State, talked about what I saw in North Carolina. They're putting solar arrays on prime farmland, and or they're not putting it on farmland. They're cutting down forests to put the solar arrays on. I just read an article in the paper today, and this is all, you know, you get this group of folks, and I am all for saving the planet. You know, I want to make sure that we do what we can do. But there's a group, and I'll say this, the Environmental Action Council. And the article I saw was on Fort Drum. Fort Drum has they burn wood chips. They've got a huge facility on there, and they are standalone. They generate, that facility generates all the power that Fort Drum needs. But because it's not, wood chips are not classified as a renewable resource. Okay? And people are concerned that they're putting pollutants into the air. It's the same people that want to stop folks from burning wood to heat their homes. The same people that want to make sure that after 2024, there are no homes built in New York State unless they're powered with electricity. Somewhere this madness has got to stop. As I said, I'm all for saving the earth, and we're doing whatever we can to make sure that it's clean, that there's no pollution, but it needs to make sense.
Okay. Nicole Ashley Terminal.
Thank you, Legislator Kern. I would like to be added as a co-sponsor on this warm and fuzzy bill as the liaison to the Environmental Management Council. And duly noted, I will bring your comments back to them for discussion.
Anyone else? Mr. Fay.
I'd like to point out that I think we can safely say that St. Lawrence County is already a green county. We generate so much hydropower, it's beyond belief. Now we're giving up all of our farmland to anybody else and sacrificing it because we are a green county already.
Okay. So, does anyone else have anything else to say? No, okay. So, Jason, I guess the Environmental Management Council will have some kind of report between you and Nicole that'll come back to us.
Yes, happy to talk with Legislator Terminelli and the EMC, and we'll put forward a course of action.
So Jason, if you would, I would like the EMC to take a position on nuclear energy and nuclear power.
I will certainly bring that to the board and have them discuss that for sure. Kevin.
Thank you, Jason.
Okay.
Welcome.
Bill, do you have your hand up?
Yes, they do.
Okay, go ahead.
I would also like to, can you hear me now?
Yes.
I would like to have the EMC board look into the life expectancy of these solar panels that we're talking about. How long do they last? And what happens when they get to the point where they don't work anymore? Where do these go? Just life expectancy of these solar panels, and what to do with them all when they all start not operating.
Thank you, Mr. Chairman. Anyone else? Mr. Akers?
So just to add to that, I think if they're going to be talking about solar panels in conjunction with Mr. Chairman Sheridan had said is, what is the environmental cost of actually producing the components of these solar panels? What's the environmental damage that's being caused? What type of child exploitation in Africa is taken to achieve these and mine these rare earth minerals or components, chemicals? That's what I would like to know too.
Okay. All in favor of this resolution?
Aye.
Aye. Any opposed to the warm and fuzzy resolution?
You're so easy.
None. Thank you. The next resolution is designating April 2022 as Fair Housing Month. Moved by Mr. Smithers, seconded by Mr. Perkins. Go ahead, Jason.
Okay, thank you. This is another standard resolution that we look to have the board pass in April, designating April as Fair Housing Month. This has been something, again, that has been done for many years. We also give you a quick update on what the Fair Housing Task Force has planned for activities during Fair Housing Month. And this year on April 28th, we will have an online presentation by the Central New York Fair Housing Agency out of Syracuse. They will be talking about the hot housing market that exists right now, the ending of the eviction moratorium, and other various bills on housing that are working their way through the Senate and Assembly in Albany.
Mr. Forsythe.
We're all warm and fuzzy again. The one thing I noticed in this first whereas, age is not included. My point is, Riverview Towers, Centennial Towers were built, my dad actually was the president of the Ogdensburg Chamber of Commerce in 1965 when Centennial opened. It was meant to be for the elderly, the stepping stone before they went to a nursing home. The Americans with Disability Act changed that drastically. Everybody is now in these places that were built for the elderly. And I think it's a shame that age isn't part of this and what they've done to these buildings. So, just one thought.
Anyone else?
Yeah,
Mr. Lightfoot?
just to put a finer point on that, you'll find that a lot of this was caused by the dumping by the Department of Mental Health, New York State Department of Mental Health. Take a look at and I'll be specific, take a look at that children's unit and the unit down at the Psych Center now. There are more employees there than there are clients, by far. And I think that it is a tragedy what they've done with some of these people. Give them a handful of pills, tell them to take them every 4 hours and turn them off. This is what happens, it's like Mr. Forsythe said, that building was built for the elderly, so they didn't end up in nursing homes. And it's turned into a little bit more than that.
Okay, thank you. Anybody else? Go on camera. All right, all in favor of this?
Aye.
Any opposed? None, motion carries. Next up, we have a resolution authorizing the chair to sign an agreement establishing the Oswegatchie River Advisory Committee. Moved by Mr. Lightfoot, seconded by Mr. Forsythe. Go ahead, Jason.
Thank you. Just a little background on this resolution. Back in 2011, the county was a signatory to the FERC relicensing agreement for dams along the Oswegatchie River. Part of that settlement agreement called for the creation of this River Advisory Council. It's taken a little bit of time. 2011 was when the FERC agreement was finished, and it's taken until March of 2022 for the development of this council, but the DEC has now put that together, and they are looking for all the original signatories to the relicensing. There are 9. St. Lawrence County is one of those 9 to sign on to this River Advisory Council. And that will allow the county an opportunity to appoint a designee to this council, and that individual will participate with the other 9 designees to allocate resources for recreational, environmental improvements, other studies, that sort of thing, along the Oswegatchie River from it's a 111-mile stretch of the Oswegatchie from Cranberry Lake to the mouth at the St. Lawrence River.
First up, Mr. Forsythe.
Jason, a 3 years ago, we heard a lot about the Blue Way Trail. Was it the Blue Way Trail that encompassed most of this? Well, whatever happened to that? Is that tied into this somehow, or is that all part of this, or is that gone?
Yeah, good question, David. It's still in existence. There was some. My understanding is there was some funding challenges with the final completion of all the Blue Way Trail information. I think there is some Blue Way designations along the Oswegatchie. I know that the city of Ogdensburg was heavily involved with that. But this is a completely separate fund. It was a fund established back in the Brookfield Power has been putting money into this fund since 2013, I believe. And it is a separate entity. It's akin to 2 other advisory councils that exist in the county, for which the county has a designee on the Racket and the West Branch of the St. Regis. Those were set up in '98 and 2001, respectively. And so it's really a sort of a separate entity. These individuals get together a couple times a year, or will get together for this one, do for the others. and just talk about, okay, what kind of improvements can we make? Can we put in a better, make the river more accessible, put in an accessible boat launch in this part of the river, or other recreational interpretive type improvements.
Jason, the other signatories will be the towns?
I have a list here of who they are. They are not the towns. Give me just for a second here. They are the DEC, Erie Boulevard Power or its successor, United States Fish and Wildlife Service, National Park Service, New York Council of Trout Unlimited, St. Lawrence County, Clifton Fine Economic Development Corporation, Adirondack Park Agency, and the Adirondack Mountain Club.
One of the reasons I ask is, will this body also be looking at issues like invasive species?
Yes, it certainly can. There's a wide array of activities that it can that are accounted for in its charge. And it says that the council and the funds may be used for projects, studies, services designated by a majority vote of the signatories to the settlement agreement. So basically, anything that you can get a majority of the 9 designees to agree to can be undertaken.
Thank you, Madam Chair. Just continue following up. I think it's important that we be involved in this, because I think, hearing who the other signatories are going to be, we need to play a very strong and active role in this to make sure that, for example, I have sat in on meetings with some of the snowmobile interests who have concerns about crossings, and who try to work with some of the power companies and are stymied in their efforts. When I look at the list of outfits, I think the county, by having, when we say we're gonna have representation, who will that be? The chairman's appointment? How does that work?
Yes, it certainly, it's the your appointment, the board, or if you designate the chair to appoint. The 2 other existing advisory councils, you appointed staff from the planning office to sit on those other 2 boards. So, but it's completely your decision.
I'm glad you bring that up, because I think that on a lot of bodies of water in the county, that where we have invasive species and we're struggling with where to come up with the money to do to address some of these problems. The reality is that the power companies who operate these dams make a great deal of money off these rivers that are in our county. And as someone who has spent many years covering the relicensing of both the New York Power Authority's dam and the relicensing on some of the dams across the county, too often we've left it to the state and other folks to make the decisions about what should be done during these relicensing. Now, you know, I'm a big advocate of adding points of access onto some of the bodies of water, and someone who's canoed the Oswegatchie extensively, I can point to several places, you know, where it needs to happen. But I also think that with the Oswegatchie facing threats from new invasive species, you know, we need to, as a body, weigh in on all three of these rivers to bring the resources that the power companies have to bear on addressing some of these serious problems that are besetting some of our prime bodies of water. And you know, we sit in some of these meetings and we flop around at, oh, what are we gonna do? Well, you know, here is an opportunity if we, you know, use it. And if there are two other bodies like this, we should make those priorities as well, so that the problems of Norwood Pond are addressed, the other problems are addressed, and you know, rather than just rely on the taxpayer for some of these solutions that, you know, the companies that are making money off the people's rivers contribute to assist in helping to address these problems. And also that we consult with the snowmobile folks and the trail folks to make sure that we don't just provide access to the canoe folks, you know, like myself, or the boating folks, but also see where we can, you know, assist the ATV riders and the snowmobile riders to safely find crossing points on some of these bodies of river, which, you know, are all, you know, through the county, because, you know, there aren't as many bridges as there used to be. So I know I've gone on too long, but you know, I think I would urge the chair to, once we do move forward with this, that we take into consideration some of these issues that I'm raising, so that we can have our representative be forceful and fight to address, you know, these and other issues that are facing these important bodies of law.
Thank you. Mr. Akers is next.
So I agree with Mr. Reagan. This is highly important. This is correct. In the fourth whereas, it says that the DEC was in charge of the settled agreement to establish an advisory council. And here, 11 years later, we're actually authorizing that establishment. Is that correct? We're 11 years out here, Jason?
That is correct. That is my understanding that, well, the dates are as they are. I'm not sure why the delay has occurred.
It's government in action. I mean, so all these issues that Mr. Reagan brought up are highly important. Actually, I was a rookie legislator, so this happened in February. So that was, Ruth, who was the county chairman then? Was it Sally Brothers? Was she the
I'd have to
legislative
look at
chair?
11.
It was, yes, Sally Brothers is the signatory.
Yeah. So you would have thought that within this 2 to 3 months that it wouldn't be that difficult to have a chairperson assign somebody from the county or somebody from the park agency. So this is just inept action by the DEC. on this matter, which is highly critical to that waterway. So how much, so this is basically the resolution is agreeing to establish the advisory council. When will the members be appointed?
That is, yes, that is the next step. I guess the initial step was to have this before you, have the county attorney take a look at the agreement, which he has before him now, and then move forward once it's signed to come forward with another resolution to appoint an individual.
So was this resolution prompted by a letter from the DEC saying, hey, we're gonna do this? This is how this came about?
Correct. Yep.
So just for the record, that's what I thought. It had to be an inaccuracy here. I thought maybe this was February 21, and then here we are a year later. No, it's 11 years. Okay, thank you, Jason.
You're welcome.
Okay, next up, sorry, is Mr. Denisha.
Thank you. Obviously, the Oswegatchie River is a very important body of water. And I think it's time there was something done. You know, this is, as Kevin says, 11 years. And listening to Jason, when he listed off the other signatories on the council. St. Lawrence County, we're given the opportunity to put somebody on as a token. No more, no less. You've got all the environment, and we talked about the environmental action. How many of the groups that are on this are environmental? They're environmental activists. And again, I'm not against environmental activism, but you know, there needs to be some sort of limit on this. And this is just offering us a token state just because we're here, and will appease, you know, the DEC and everyone else wants to appease St. Lawrence County. So to give someone who will have absolutely no voice, none.
Next up was Mr. Lightfoot.
Give me a second, please. Who is it that you were having again?
You had raised your hand, it was your turn.
Oh, no.
Pass, okay. Mr. Forsythe, you had raised your hand, then it was your turn. Did you have anything else to say, or you passing?
I have no question.
Okay, you raised your hand.
It's Mr. Reagan has to say.
Actually, Mr. Perkins was first, and then Mr. Reagan.
Thank you. I agree with Jim and Larry. Larry, you hit the nail right on the head right there. The stakeholders, we need our own people of interest in there. Our local towns that are along the river, the recreation groups, I mean, I could go on and on. I've had some of these issues on the Racket River through my townships, and it is very difficult because we don't have much of a voice. I would like to table this. I'm proposing to table this and have maybe Jason go back to the DEC or whoever it is that's actually putting this out to include local representation and recreational groups and have them have a voice, not just be there without a say. So I'd like to put that out there.
Is there a second to table?
I'll second it.
Right. Okay, so we have multiple seconds to table now. Okay, is it, we said tabling? No discussion. All in favor of tabling?
Aye.
Aye.
This is tabled until when?
Until we can get some information back from Jason from the DC.
Okay.
Can we put a date on that?
1 month.
A month?
Next
That'd be fine.
operations.
Next operations, so table to next operations, thank you.
Anything that who's against?
Oh, I'm sorry, who was against it, tabling, anybody?
I was.
You're against tabling it?
Yes, I am.
Okay. Thank you. All right, thank you, Jason.
I do have just one more item, if I may. if that's the pleasure of the chair, to address the question that was asked 2 weeks ago about COVID mapping.
Yes.
Would you like me to address that now?
Yes, that would be lovely.
Okay. So, thank you. So a couple weeks ago at the full board meeting in March, the question was posed as to why the COVID mapping has been discontinued. And I can give you several reasons why that has been done. The first and foremost really is just based on the data. The numbers have dropped off significantly in terms of case count. In January, the 10th of January, there were 1,863 active cases, COVID cases in the county. Today, there are 174, so that's a really significant drop. The other main reason is that the maps really have outlived their utility. And what I mean by that is when we originally prepared the maps, we were looking for areas of high concentration of COVID. Where were the most cases of COVID present? And we're looking in that in order, really, why you do any type of spatial analysis is to allocate resources accordingly. So if we had a higher concentration over here, we would look to put more resources in a certain part of the county. Well, it quickly became aware that COVID was everywhere in the county, and the numbers were high everywhere. And there are certainly higher numbers in different areas, but that's strictly based on population. So you have a really high count in Ogdensburg, city of Ogdensburg, or the town of Messina, town of Canton, town of Potsdam. The reason those numbers are so high, or were so high, is because of the population count being higher. That's why our COVID numbers were higher. So that really doesn't lend itself to any type of analysis through a mapping type of exercise. It may be, it may be interesting to see, okay, well, look how many cases we have in this community versus this community. But in reality, the COVID still is to a certain extent, but was everywhere in the county. So really the rationale and the utility of that mapping sort of went away, and that's the rationale for the discontinuance. There was a lot of conversation, a lot of discussion with public health about this with the county administrator, and the consensus was that the mapping could and really should go away, and that's why it did discontinue after the 18th of February. So happy to answer any specific questions on that, or look to give you some more information as needed.
Does anyone have any more questions for Jason?
And just to follow up on that, I think you have all seen or do now know that we have updated the COVID Center and the data that we provide every day. We also may be in the near future looking at reducing that. We're looking with Jefferson and Lewis County at staying on the same track like we have throughout, and doing, when the numbers were extraordinarily high, we did 7 days a week. And then when things dropped off, we went down to 3 days a week. So we talked about this at NISAC, potentially looking at reducing some of that. But what the transition we've made in the COVID Center is really looking more at the hospitalization, which if we go way back to the beginning of COVID, that's why we watched any of this, was the impact it had on our hospital beds, availability, and the stresses it placed on our healthcare. So that's actually where we've come full circle now. We're talking and looking at hospitalizations and availability of beds in the unit. So that's what you see in our COVID mapping today. But certainly, as Jason said, other bits of information that start to come out as far as relevant, we try to bring that to you, make sure that you're aware. And I'll give you some statistics, just basic ones, as we continue forward in our meetings when we meet at each of the committees.
Thank you. Okay, that's it. Thank you, Jason.
Thank you.
Next up, we have Human Resources, Johnny Dorothy. There's Johnny. I have a resolution approving St. Louis County Affirmative Action / Equal Employment / Family Medical Leave Act, Americas with Disabilities Act Plan as amended. Moved by Mr. Denisha, seconded by Mr. Forsythe. Danny, go ahead.
Thank you. Good evening. So the plan hasn't been updated since 2017, and a new affirmative action officer was appointed in 2019. Can you hear me all right?
Yes.
Yes.
Okay. So I would update the plan to include the plan name to change to better reflect what the plan reflects. So the overall plan would still reference and encompass ADA and FMLA policies and practices, but it would not be included in the actual name anymore of the plan. And I would update I would be wanting to update the affirmative action officer and all references associated with that throughout the document. I would want to add goals to check and evaluate each year. I'm replacing the HR director signature on the policy statement page with the Board of Legislators chair signature as it signifies. I will be updating and expanding the definitions of disability as defined in the amended ADA Act. I'd be updating to include the new protected groups. I'm updating all contacts throughout the plan. I'm adding relevant forms as attachments, which include the complaint form, the medical form, and the accommodation request form. And finally, and probably most notably, I'm removing specifics related to disability accommodations in coordination with respect to Section 504 in Title VI, which refer to discrimination on the basis of disability in programs and activities receiving federal financial assistance versus employment opportunities or activities. And Jason Fotohauer was appointed the coordinator of Title VI within the past year, I believe. And he has developed a plan and he's put policies and procedures in place. So in this affirmative action plan, I reference his contact information and where to find out more information related to our Title VI in Section 504 plans and complaint processes. So I take out the information, the specifics about that Title VI in Section 504, and I reference it, them to go to that plan. And those are the changes that overall changes that I'm looking to make.
Are there any questions for Johnny on that? Mr. Smithers?
Yeah, I have some problem with this plan. I think back when the affirmative action order was signed by President Kennedy 60 years ago, there probably could be no doubt there was a need for that was recognized. Today, affirmative action, I think we've gone past where that's needed. I want to read these definitions of affirmative action, which to me are dangerous. Practice or policy of favoring individuals belonging to groups known to have been discriminated against previously, and the act or practice of giving preferential treatment to underrepresented groups who have been discriminated against in the past. And when my feeling is when you give one individual or group favor or preference, someone else is by definition repressed or discriminated against. I'm all for equal opportunity, providing that. Over on part one of this, there's St. Lawrence County will develop educational training programs for all employees with due emphasis on our goal of providing advancement opportunities for protected group members. Those protected group members are over on this page. So when we do that, we're discriminating against another individual or group. We should certainly comply with all federal and state mandated laws and policies. says that affirmative action is voluntary. It's not required by law. Says it's not so-called reverse discrimination. I would say it definitely is reverse discrimination when you have affirmative action. Over further, says that we should encourage employees to self-identify. I don't believe that St. Lawrence County should affirm as valid all aspects of an individual's self-identity. We're seeing cases of this crop up where people identify in various ways that are questionable, particularly gender identity. And we're seeing cases in other states where when one person's identity interferes with or inhibits or threatens other individuals, particularly of a gender that's not the same, or access in restrooms or on sports teams. And this is just the beginning of that. So I think this is dangerous territory. And I think there's definitely work that needs to be done on this. It's a needed program, but there's language in here that I think is something that I cannot support.
Mr. Forsythe.
Welcome to New York. I agree. I think I read on North Country Now, one of those publications that to get a marijuana distribution license, you got to be a prior marijuana criminal. Tim Page earlier said bail reform. Bail reform. So let's do bail reform. Forget about the people that are offended. This is New York at its finest right here. All this stuff. So I couldn't agree with you more.
Mr. Akers.
John, is this resolution required?
I know I was appointed the affirmative action officer in 2019, and my direction was to put the plan in place, or to have the plan in place, and actually it was already in place, and I've just updated it since then.
Is there a state requirement that St. Lawrence County has an affirmative action officer?
You know, I've heard it both ways. I'm not positive on that, but I do know we have to have an affirmative action program in order to get, like community services this year had a grant that they, I think it was for the opioid grant. I actually had to go in and do an affirmative action plan, go out there to one of their websites and put in our plan and put in all of our information to make sure that we could receive that grant. So I do believe that it's needed to receive federal funding assistance. Is it just? Go ahead.
I'll ask the county administrator, can you speak to this?
As far as federal requirements?
Yeah, federal or state requirement
there are
that
some.
we actually have an affirmative action officer.
I believe that we have since at least 2017. I can find out if we're required to. That may be a Steve question, but we can find that out. I know that we had one in place. I know that actually they were looking at the need to strengthen some of the areas and clean up some of the language. I think that's mostly what John was trying to do here.
The body of the language, why would we have a simple mission statement where St. Lawrence County will hire on merit, ability, and potential?
That could be an amendment.
The
Steve's here. He may be able to speak to
attorney is
that.
here, because he joined us. Mr. Button, could you guide us a little bit on this?
I can, thank you. 41 CFR 60.2 actually requires that we have an affirmative action plan. As a part of that plan, we are required to establish a designated agency for due process for complaints that would be managed under that plan. 41 CFR 60.2 is a federal regulation for the implementation of an affirmative action plan. So to answer the question as to whether or not we are required to have a plan as a federal contractor, that is correct. To answer whether or not we have to have a plan administrator or someone on site that has been designated to handle complaints, that is also correct.
But do we need to have the language that Mr. Smithers is bothered by? Is that part of the federal law?
I apologize. I didn't catch the specific language that Mr. Smithers is bothered by.
Mr. Smithers, do you have a moment and just kind of,
Well, to me, affirmative action by definition is policy of favoring or giving preferential treatment to underrepresented groups who've experienced discrimination in the past. And when you give one individual or group preferential or favorable treatment, you are repressing or discriminating against somebody else. That's something that to me is obvious. So one of the statements in this policy of part 1 is that St. Lawrence County will develop educational and training programs for all employees with due emphasis on our goal of providing advancement opportunities for protected group members. When you single out certain groups to give advancement opportunities for, instead of saying they're for everybody, you're discriminating against some groups or individuals.
If the question is whether or not that language is required, that language actually tails on what is sample language for an adopted affirmative action plan that is both encouraged by the state and encouraged by the federal government. So would I tell you that that's required? I don't believe that I can say that that's required, but can I tell you that that is the model language that they have put out there? It is.
any further comment? Mr. Akers?
But there's so many changes in the document itself, so many yellow lines with things that need to be stricken, that I would make a motion to table this until operations of next month.
Seconded by Mr.
With a complete document without the yellow.
Yep. So Akers, Campbell, Slick, second. All in favor of tabling this,
Aye.
raise your hand.
Aye.
Aye. Any opposed?
Aye or nay?
Margaret Hyder is opposed and Tony, our clerk is opposed. So no. No. Oh, sorry, I'm sorry.
No, I was not opposed.
Oh, okay, you said your hand up. Okay, sorry, just Margaret opposed then. Okay. So we will table it until next month.
Operations.
Until operations. Thank you. And thank you, Johnny Dorsey. All right, next up, we have the Vacancy Review Committee with Mrs. Short.
We have 4 departments that are each bringing forward one before you this evening. The first is Emergency Services.
Good evening, everybody. This vacancy I'm bringing forward is a longtime dispatcher, one of our ones that have been there probably one of the longest. She made the decision to retire, I think, after 35 years, which is well deserved. So, which opened up a vacancy on a full-time position. We do have a temporary position. We'd like to move to part-time and then a part-time up to this full-time. I'm looking for immediate fill, please.
Any questions? Any questions? And as a reminder, the part-time positions don't come before you. We keep those full. Next up, thank you, Matt.
Thank you, guys.
Absolutely. Happy to help.
Next up is the sheriff.
Good morning, or excuse me, good evening, everybody.
Good evening.
So, I'm looking to restore a chief civil position. A little background on this. Last year, if you remember, we reconstructed the civil division because of the deputies. We went to a chief deputy position. The chief civil officer was due to retire or wanted to retire sometime this spring. Due to unforeseen circumstances, he's not going to retire. He's changed his mind. He may by the end of the year. Some things happened where he just changed his mind. So I'm kind of stuck into a spot where I need to restore this position until the end of the year. We did a cost out of this, and it's going to cost $55,700 for salary and total fringe for the remainder of the year. That was not budgeted. He was budgeted for a third of the year. I can tell you that we have a severe increase in activity in the civil department in the last few months because of COVID is kind of waning. That's a positive, but the negative is the civil department is very swamped, catching up from 2 years of inactivity. Right now, we have 350 eviction applications that have come forward. We're doing 1 to 2 evictions a day on average lately. And then in the year 2021, we only had a total of 20 evictions the whole year. We're expecting at least 350 applications and maybe 200 that will get through the applications. Because of that, we get $250 per eviction. If you add up all that revenue, it's about $22,000 more than we budgeted for the civil department when it comes to evictions. We also have an uptick in our DOS family court services, the papers and other things we do for them. We mapped that out for the year, and because it's such an increase from the last 2 years, we're looking at another $18,800 probably in revenue that wasn't budgeted for this year. We also, maybe you've heard, the amended execution rate at the state level has changed from 9% to 2% for all your garnishment and other fees. And anybody that has an execution through the civil department has to come and reapply. When they do reapply, they have to pay a fee. And we priced that out to be about $6,000. So the extra revenue we're looking for at the civil department this year will be about $46,600 more in planned revenue, which almost really gets us to that $55,000 cost. Some other cost things that we're working on is we have a part-time position that hasn't been filled in the road patrol as of yet. We don't foresee it being filled because there's classification problems, and quite frankly, nobody wants to take the position anymore. So we're going to save about $23,000 in not filling that position. We also have another part-timer that's getting done very soon. So we're going to save another third of the year on that salary. So we're up to about, between the revenue and the cost savings from the road patrol, about over $80,000 that will pay for the $55,700. I can tell you that because of the increased workload, having that civil chief officer there is definitely going to help. We're going to be really swamped. He is in the process of training the new chief deputy. He's only been doing it 2.5 months, 3 months. That's probably a year process to train properly a chief deputy. And the third part that we're going to try to do this year and have been already trying to do for the last 3 or 4 months is getting that civil department accredited. A lot of accounting is done, a lot of money's changing hands. And when you have accreditation backing you, it helps with liability and all the other structures that need to be done in the civil department. So with all that being said, I'm looking to restore this position until the end of the year.
Thank you. Questions? Thank you, Sheriff.
Thank you.
The next one we have is Melissa Friedel is here for Sandy Santamore this evening. I think she is.
She's there.
With us. You saw her? Okay. There she is. Melissa, can you hear us?
I can, but it's not on muting. Can you hear me?
No, we can hear you. We just can't see you.
And my camera is not appearing to be functioning, I guess.
There you are.
There you are.
Can you see me?
No.
Almost.
Almost.
Whatever you did.
Move it the other way.
Yeah.
There you go.
There. Leave it.
Good? Okay.
Good. Hi.
Hi.
You want
Sorry.
to speak to the create and fill the DMV clerk?
So all it basically is we had a temporary position that we're looking to get to a part-time position. We had a vacancy and we hired back one of our longtime DMV clerks that retired. And the temporary is just not going to be a long enough time frame to get us to the active list. The DMV test was given and we're not going to have the list in time because the temp position is only 3 months and the part-time is going to give us more time to get through our busy time frame while we get hopefully a list and somebody trained to fill that position.
And this would be intended to remain a part-time, right?
Correct. Yep.
That wasn't listed here, so that would be the goal.
Yes.
Yes.
Yep.
Mr. Forsythe.
I have no issue with it. My question is the hours per week, 0 to 35. So that's pretty broad. How do you?
So I think one of the things that we were looking at is, in years past, you've heard county clerks come in and talk about having, 6 totes to do. But other weeks they may not, and may have not everybody on vacation. So they were looking for the flexibility to say, call them in when they have an overabundance of work or a shortage of staff or vacation. But I can talk with her about coming up with an average. I mean, a perfect average would be 17 and a half, but
I just think of in the jail, we have part-time correction that we utilize, and we pay them a set rate of 17 or 19 or whatever bucks an hour. This kind of is too vague
to be wide open. We can get more specifics on that.
I appreciate it.
Yep. Any other questions? Thank you, Melissa.
Thank you.
And the last one under vacancy this evening is for planning. Jason?
Thank you, Ruth. Good evening again. Planning is looking to abolish a planner 2 position and create and fill a planner 3 position. The intent here is threefold. The first reason is to provide appropriate compensation for the position assigned to do transportation planning work in the office here. Second reason is to fill a senior level staffing void that occurred when the deputy director position was eliminated in 2019. And the third reason is to provide career advancement opportunities within the department, which may attract and retain staff.
Any questions? Jason, did you have anything else on that?
Nope, not at this point unless there are questions.
Okay, I think that does it. Thank you. That
Thank you.
concludes vacancy for operations.
Okay. So now we have
Yes, can we do the resolution first?
I'm sorry.
That's okay. Is that all, if that's all the same? I can read it if you want.
No, I just had to find it.
After the vacancies, before the biographical data sheets.
Yeah, can you read it?
Yeah, I'd be happy to.
You gave it back too quick.
So the resolution is authorizing the chair to sign a contract with the Rural Law Center of New York for indigent appellate representation.
Moved by Mr. Lightfoot, seconded by Mr. Forsythe.
And I can speak to it if that's
Go
okay.
ahead.
Okay, so Rural Law Center came along and really helped fill a void that the county has. As you're aware, we have a public defender's office who handles family and criminal. We have a conflict defender's office that was created back in 2004 that also handles family court and criminal. And from the appeals perspective, we mostly utilize outside counsel. And we continue to for our parole appeals for the most part. But the Rural Law Center has stepped into a void that was created when appeals need to be filed, need to be reviewed, and in the event that they are and seek perfection, so to speak, they are carried by the Rural Law Center. So we've looked at the work that they've done. Our hope is that we can continue our relationship with them. They are contacted directly by the third department. So this doesn't add volume to our indigent assignment process that's currently in place either. And our hope is to move this forward. I am continuing to look at the number of appeals, and I've talked with Steve a little bit about the arrangements here. My hope would be that you would look favorably upon this to the board meeting, and if in fact we were going to either adjust the number of appeals or the amount prospectively. They haven't changed the number. It's $2,500 per appeal. But with COVID, there's a couple of variables, that have changed our standard. Look at 3 years, make your assessment. You can make some predictions. So we're still looking at that. But our hope is, because we're going to see this contract end March 31st, April 4th would be the approval. If we aren't able to get that approval, they hold the appeals, and that can hold up the process associated with those appeals that are filed. Questions?
Seeing none.
Take a vote?
No, I just wanted to make sure you have. anything
Yeah,
else
no,
to say.
I'm all set.
All in favor of this?
Aye.
Any opposed? Motion carries.
Thank you, and I just have a few updates. So as I mentioned, to give you a little bit of a COVID update, we finished, and thank you all who were able to help us distribute COVID supplies to the towns, the villages, and the city. We were able to push some materials out more locally. As you'll recall, we did our distribution event. That may occur again in the future if we have a bigger surplus and there's a need. We still have about 13,000 test kits. So if you are approached, we're going to work to try to push some out to businesses as well to have on hand. And we also have some more KN90 masks. So if you're interested in those or you're hearing requests, reach out. We'll make sure we connect with folks and get those to them. There is an extension. You saw an email from Kelly today of the executive orders through April 15th, which will continue to allow remote attendance. I do, though, in the near future, want to talk to the board about even beyond the days where remote attendance is allowed with regard to our department heads. Several, if not probably all at some point, have shared with me how much nicer it is from a work-life perspective for them to be able to, as many have and continue to, even when you can't see their faces, you call their name and there they are. And they can present to you at a moment's notice, rather than sitting in the chambers all evening, waiting to be called upon, and often not, because they're so well prepared and they've given you all the information that you need. So I would like to ask that you give some thought to the idea. They do really appreciate, I've not had any trouble getting their attendance remotely. I think they provide the information, but just something to think about as we move back into an environment where the in-person, this really gives them the opportunity. They head on home, they log on to our meeting, and they can return to their lives. But certainly I will speak for them all when I say they will all be here in person if that's your preference also.
Yes, Mr. Burke.
Just not to interrupt, but at that point, I had it under old business, new business. I have a tremendous time hearing certain individuals on this.
Okay.
I mean, like a tremendous time. I lose 60% easily of the conversation of what I really want to listen to.
Sure.
And I asked a couple others have the same issue.
Okay.
So I don't know if it's the echo in this room. I know I don't hear well anyway.
I think it's also the equipment that we are trying to make work.
But I have a heck of a time with it. And really, I don't like to lose 60% of the conversation.
Okay.
It just,
So
to
if
me,
that were an option, we need to get you better sound
and
quality.
if someone was on the agenda and we knew they were going to, the department head, yeah, I think I'd rather have them here in person so I can hear them better myself.
Okay.
Not to.
Yeah, I know it's good feedback, and I can certainly
I just
share.
think I'm losing too much of it. Heather, when she made her presentation, you know, and she knows it inside and out, but I can't grab, you know, I'm just trying to pick a word here and there.
Sure.
You know, so it's hard for me, and I'm sure there's others.
No, that's good feedback.
So that's just my thought.
Okay, certainly. With regard to the numbers attached to this week's numbers, the per 100,000 is a number we focus on a little bit more now. That number is 149.43. Over the weekend, we had 105 cases total, and there are currently 6 in the hospital, with averaging approximately 46 average cases per day. If you recall, not too long ago, we were well in the 200, 300, 400s for a period of time.
Mr. Smithers.
On these test kits, can you tell us how long they're good for? There's an expiration date on the box.
There is.
And what's the found validity of the tests? Are they pretty valid or kind of so-so?
I can't venture into that territory, but I can certainly get someone who can. But I think that the test kits we have on hand now, some expire in May and some expire, I believe, in June. So we are looking to push those out to get used. There has been some discussion, real brief discussion about them actually being good beyond the date on the box. But again, if we can get them used in that time frame, it's certainly preferable. I can get some information on what the reliability is. I think that's what you're looking for here. The reliability or the expiration?
The like specificity and that stuff should be
included
in a little sheet.
Oh, okay.
Mr. Akers?
So to answer your question, is public health is accepting anybody who takes that test and has a positive result, that's going down, that's being recorded as a positive test. It's not like you're taking a test at home and you test positive, that you go to one of their facilities and test.
Duplicate.
positive.
Yeah, there's,
They're taking your,
That's right.
your home result is being reported. I will mention, you mentioned the 6 or 7 that are in the hospital, half of them are incidental. They came in for an operation,
Yes.
broken bone.
Yep.
Okay, and that's kind of about the average, a little bit leaning, a little bit more towards those that are in there for COVID, let's say 4 COVID, 3
Pretty
that
much.
came in with broken bones or stitches.
That also
had COVID,
happened.
didn't know they had.
Yeah,
What about
and that's in our
reverse?
COVID center as well.
If you have a negative test, is that being widely?
You don't
accepted?
report it.
That is not,
You're not. you
and I was
don't
gonna
report it.
mention that.
It's not being tested. You know, if you don't feel well, you got a sore throat, you take a test, and you test negative, you're not gonna call public health and say, hey, I'm clean.
Places that require a negative test, are they accepting that test?
So that, I don't know
That's a good
I don't know if you go across the border, if you have one of these tests,
I don't think they
I
count.
think you still need
PCR, yeah, I think so too.
it's gonna be a different test.
Mr. Light.
To go to the hospital for a procedure, they more than likely will require that you have a COVID test. And the one you do at home is for your own personal gratification. It is not proof that you either do or do not have COVID. You've got to go to somebody with a PCR, and that's the way it has to be with PCR.
Okay. So that concludes the COVID update. I just want to let you know also the NISAC conference, there were 5 of us that attended, 2 legislators, 3 staff. And what we're going to do this time is schedule a Zoom meeting to go over. We sort of, as many of you have experienced in the past, divide and conquer different learning opportunities or different seminars. Want to pull that together and bring the board a report, but also look at the resolutions that NISAC adopted and bring those to you with interest over the next month. Lots of information shared, ARPA discussions. I'm going to bring you some additional information. In my county administrators meeting, there was sort of a round robin of what are you doing with your COVID funds. So I have captured all the counties that reported out, and I'll bring that to you as well so that you have a little bit better of an understanding. The ARPA final rule doesn't go into effect until April 1st. So I just wanted you to be aware of that. Some counties are appropriating under the interim rule or the preemptive release of the final rule, but that's really when the final rule goes into effect. But they are looking for standing committee members. I will also capture for you who we have committee members sitting on their standing committees. And if you're interested, there's a few areas they would like to see some St. Lawrence County representation. So we'll share that with you as well. Wanted to give you an update. I was asked what the total currently is in the employee recognition program that you all contribute to. And that is currently $3,148.98. In 2022, we spent $2,900. We provided some lunch opportunities, some different opportunities in the way of coffee and get together as COVID would allow. Now that those restrictions are starting to wax and wane, we're excited to do some things together again. And I can get you a list of what those items were. This Wednesday, we're looking at doing some employee appreciation. You may remember March 4th was actually, I guess, National Employee Appreciation Day. So we were able also to do some nice things for our staff as well. So that we're excited about. If you have suggestions or you're hearing or where you're affiliated with has some nice activities that could be shared, we welcome the input. Certainly want to make sure our employees know that we appreciate their efforts. We are making progress on the public safety complex efforts for the project there. We meet tomorrow with the architect with Buildings and Grounds Committee. We're reviewing alternative mechanical systems. So in some of the talks about alternative energy opportunities, one of the areas we're looking at are geothermal. And so they have done some evaluation for us. We're going to have those discussions with the Buildings and Grounds Committee and make some assessment there so that that committee can bring a recommendation to the board. We also would like to begin discussions on the roof for the sheriff's house and the cell area of the old jail. For those of you who have had the opportunity to walk through, you certainly noticed that there are some leaks and things that we need to shore up, particularly if we're looking at records management being a big part of the function of that. We want to make sure it's dry and climate controlled. So that you'll be looking at here in the near future as well. I want to step back a little bit to Legislator Reagan's comments, certainly greatly appreciated, and certainly Legislator Denisha's as well. But our county shifted. We opened an EOC last week on the 8th, actually, so it'd be 10 days ago from last Friday. It was a pivot and a focus to make sure the needs were met of all of the folks that were in need that day and that week. A debrief of all the agencies that were involved, including the Housing Authority, will be scheduled. Many of the agencies involved certainly have the common core of the North Country. We take care of each other. We're fortunate to have a place like Wadhams, as Legislator Lightfoot mentioned, but there were tremendous, I'm sure you all, no one was isolated from the fact that the donations were overwhelming, whether it was time, money, stuff, whatever it was overwhelming how much came and how quickly it arrived. So managing that and making sure it got to the folks who needed it was paramount as well. Pulled in our external partners like the IDA and the Chamber of Commerce. And so any and every were willing to help. It was really remarkable. And truly no challenge was left unmet. Ogdensburg Free Academy was mentioned. Certainly they loaned us one of our premier stars of the effort, John Miller, who cannot be left unsaid. He really stepped forward and was our site lead for the entire term of us being there. So 10 days, once we stepped to Wadhams Hall, all residents were placed by 2 p.m. last Friday. We had 104 total displaced from the fire itself. We started out with 36 at Wadhams. We went up over the days that followed up to 51. And then when we eventually ended up placing everyone, I believe there were only 2 that ended up staying in a hotel over the weekend, and they were placed today. So a remarkable effort. The county went and never left until the last resident was placed. So you should be very proud of all the folks, and mentioned the counseling, probation, social services. One of the biggest things that was a challenge for us was refilling all of those prescriptions for folks who walked away. They left their glasses, they left everything. And so Hepburn loaned us a nurse who continued to show up until all of that was helped. Kim Rose Medicine Place, Kinney's, like all of you have said, there's no way to mention everyone who helped, but it was remarkable. And in these difficult times, I think it was really nice to have our faith in human nature restored a little bit. So it was really, really awesome. Next month, I think we're going to try and bring a couple of those folks in before you, just to let them know how much we appreciate their efforts. So certainly proud of all of the work of county staff and everyone in the county who helped. I do want to mention, we talked earlier on a few months ago about a SWOT analysis of Ogdensburg. With everything that's happened in the last couple of weeks, it's not quite complete. I will bring that to you at the Finance Committee. Chairman Akers does not object. Want to let you know also, we talked a little bit about the challenges we face with the funeral directors traveling the greater distances now. I'm meeting with Jolene tomorrow to finalize that and hope to bring that to you on finance to also consider how we might address that. And then one of the last items I have is the trails. Season 2 is ramping up. Passes are being printed now. Dylan is leading the charge, working with the existing sellers from last season, and then also training a few new sellers. Our hope is that they're online beginning of April, second week of April, and then online sales to begin the middle of April as well. So that will give us a whole month. As you may recall, last year it was, once the law was passed and everything was put into place, it was really a remarkable effort to get everything online by Memorial Day. So this year we hope we're much more organized. We've learned from our effort last year, and we should have everything online at least 1 month before the trails open. So now we just pray for good weather. Any questions?
Just one on the trails. A few months ago, I brought up, Tony, the idea of kind of like the snowmobile registration, a percentage of it going to help fund the trail system. Has there ever been any talk of that or consideration, you know?
Ms. Chairman?
Yes.
Yes, a big portion of that goes to the trail. As a matter of fact, 100% of all the trail passes goes directly back in to the trail system. Last year we had two clubs that you could choose from when you applied for your trail pass online, and that was a reduction in the overall trail pass, but some of that, a small portion of that money goes to the trails. This year it looks like we're looking at 4 separate clubs. So there'll be a portion of money from the trail pass that'll go to those clubs, but also the responsibility of those clubs to, to maintain a certain region in and around their clubs, and then a further commitment to help maintain the county-wide trail system in its entirety. Each one of the clubs need to sign on to that agreement before any money will be allocated from the trail pass to them. But the other, the administrational cost is also a part of it. But other than the administrational cost, 100% of the money is going back into the maintenance, upkeep, insurance, education, some other percentages that the Trails Committee agreed upon last year at the onset of the trail pass. So we've got it spread into key areas, and hopefully that'll keep us sustainable for many years to come, and self-sufficient as well. Thanks, Dave.
Thank you.
Anyone else?
Other questions? That's all I have, Madam Chair.
Thank you very much. Committee reports, the Agriculture and Farmland Protection Board, Mr. Denisha.
Nothing to report since the last meeting.
Mr. Burke is not here. Board of Trustees, Ms. D'Angelo's not here. Emergency Medicine Services Advisory Board. I sent everybody out by email the minutes from the last meeting, and the next meeting is tomorrow. Did anybody have any questions from them? The Environmental Management Council, Mr. Manelli.
Thank you, Madam Chair. We had our last meeting on, can you hear me okay? Yes. Okay. We had our last meeting on March 16th. Our presentation was from Zinzun and Blake. They're representatives from Talking Wings, which is an environmental storytelling organization, as well as Thomas Lindsay, an attorney that's been working with them. They are going to be presenting a virtual symposium tomorrow, actually, night at 6:30. About the rights of nature. And so they just kind of covered some of the topics or issues that are coming up, or advocacy, I guess I would say, that's coming up surrounding the rights of nature, primarily waterways, and looking at indigenous treatment of nature versus the European and Western view of nature. They shared with us some of the current litigation going on across the country and in other communities and countries around the world. The city of Pittsburgh, and some tribal laws that have been enacted to protect the rights of water. More information on that can be found at it's centerforenvironmentalrights.org. And then in addition to that, in the committees of the EMC, the Conservation of Resources Committee reported out on the Climate Action Plan review. The entire EMC is actually taking on different segments of that Climate Action Plan review due to either interest in a particular content area or just divide and conquer, so that they were able to review the entire 342-page document. They're drafting up comments on the sections that they've either opted to take or they've been assigned to take, and we'll be bringing that back together at the next committee meeting in April. And the EMC will vote in the comments that they would like included in that review, the public comment for that. As Jason had mentioned, for the Earth Day resolution, the Youth Advisory Board is partnering with the EMC on some pollinator gardens across the county, one starting in Canton and then some others that we've got some seeds for to spread around. Water chestnut pull has been announced on June 25th on the Oswegatchie River near Black Lake. The Invasive Species Committee looked at the SLELO PRISM, the tiered list that's out of invasives, the ones that are top priority, and then down to the ones that are just on the watch list. And I think that that's about it.
Thank you very much. Does anyone have any questions for Ms. Miller? All right, seeing none. We go on to the Fire Advisory Board determination.
Fire Advisory Board met on March 10th. And some of the things that were discussed very positively in regards to Jody Wenzel, and who's our risk manager, who's going around to the different fire departments and conducting audits. And it's been received quite well in most of the departments. It's like the saying, I'm from the government, I'm here to help. Well, he really is here to help. Talked about the dispatch center, that it's going to be moved, within a year, hopefully. There was discussion about dispatchers and PTSD. We had a discussion about that a few months ago, about the person that was in the water. And training center is set for April 2 start. And there was some discussion regarding holding some additional training with Franklin County to limit the need to travel. So with some shared resources. And next meeting is Thursday, March 12th.
Okay, thank you. Does anyone have any questions for Mr. Commissioner? Seeing none. Oh, do you have a question?
I was itching.
You're itching, okay. So Inter-County Legislative Committee was at NISAC. So Ruth, did you get over there?
I did. They didn't really hold a meeting as much as they had someone from the Northern Border Regional Economic Development Commission attend, and he presented to them. They're going to share the slides and we can send them out to the board.
Okay, thank you. The jury board, Mr. Sheridan.
Thank you, Madam Chair. The jury board did not meet. We haven't met recently.
Okay. The planning board, Mr. Fay.
Okay, under project reviews, we had some referrals, returned one to the town of Oswegatchie for a subdivision off Route 37, one in the town of Brazier for a special permit for a business that bought the Knights of Columbus building for entertainment there. And this is one of the first times I can remember that we had no full reviews, mainly because there was no solar panel stuff coming at us at all. And our next meeting is second Thursday of next month.
That completes that. How about old and new business? Mr. Perkins.
I sent an email out to everybody regarding a meeting I went to that the EMS director and deputy, Matt Denner and Jonathan Mitchell put on. It was very enlightening. We have a lot of issues in the county regarding our ambulatory services. We're definitely lacking EMT drivers. There's tons of calls. I know I brought it to the board last year that the town of Parrishville, well, the rescue department, they were answering calls all around the county and not answering. There was nobody in our own township to answer calls, and so there were some people that were very upset. There were 2,700 calls last year that went unanswered. One was a death. There's a lot of training. There's costs associated with the training. Somehow we have to help the age of the people that were at this district meeting that I was at. They're elderly, well, our age. Very few years. There were a couple, but I remember growing up going to the field days. It was the grandfather, his son, and the grandsons that are all participating in these departments. We don't have that anymore. We have a serious situation coming up, and I suggest if you can go to any of these meetings, I suggest you do it, because there's no clear answer how to fix it. But all the help we can get would be appreciated. But Jonathan and Matt Denner did an awesome job.
Yes. So Nicole, I'll let you go. Next. Nicole.
Yeah, I've received a couple of emails from some constituents that are also very, very concerned. If anybody wasn't able to attend their local one, I did reach out to Matt to see when their next one was, because I wasn't available the night that they had theirs in Messina. On Tuesday, the 29th at 6 o'clock, they are going to be in Norfolk, if anybody wants to attend.
Yeah, I was just gonna say that. Larry and I went to a meeting probably 2-3 months ago where Matt and Jonathan put on a wonderful presentation about how they wanted to have the county help do some of this and arrange some of the training. And the people that run the fire or run the ambulance services now kind of ate us alive. And basically did not want anyone even talking about the county getting involved in EMS because of what it would do to the people that are already there. There is a bill in the assembly that talks about the fact that EMS is one of the only services that everyone tries to provide that is not funded in any way by the state. There's like not any support for reimbursement. They make it very difficult for training. We don't get a lot of good training around here. I know 5 people myself that used to do EMS all the time, but during COVID, they just gave up. They're like, you can't get to the training, you try to take a day off for the training, your employer won't give you a day off for the training. And finally, I mean, at the end of it, the cost of getting trained has gone up. And I mean, this is a volunteer thing, and you're looking at some of these courses are $2,700. And so I said, you know, why maybe the county could help offset the cost of the training. And people just really, my impression, you were there, people were not that interested in having us get really involved.
The ones that probably get shot for saying this, but the ones that didn't have a lot of interest in it were the paid, the paid departments. Volunteer departments had some interest. But I think the biggest pushback came from the paid rescue squads. They're in business. You know, we did talk about, and I was, well, at that one, there was what, 60 people there probably. I was at another one last month that Matt and Jonathan had in Richville. And it was Edwards was there, Governor, Richville Fire Department, Herman. But you know, the topic came up then, as came up at that meeting at the fire, at the training center, was looking to see, and it was in regards to training, to see if BOCES couldn't do something. You know, BOCES, we have students that go to BOCES and they come out of BOCES as a nurse. We have people that go to BOCES and they come out with beauticians. They come out as electricians. They come out as carpenters. You know, it would be. I think it's an opportunity to. I think we're missing because there are a lot of young people that are in. Look at the Sagat's Harbor.
Story.
You know, they have the students. But if we were to get our students, 16, 17-year-old students, offer a course at BOCES, you know, a lot of them don't want to go away. They don't want to leave. A lot of them like being involved in the rescue service or the fire service. But once they get out of high school, they don't have the time, they don't have the money. You know, I think the desire is still there, but it's the time and the money. If we were to get those folks when they're still in high school, give them some training, and maybe they're not all going to stay. Some of them are going to leave. But if we, you know, if we can retain 25% of them, 50%, you know, I think it's an opportunity we're missing. And
No, I totally agree with you. I think we have 2 other things, and sorry, Dave, I'll let you go. 2 other things that we don't do in New York State that other states do. There are bridge programs in other states, and like a 6-month course from RN to paramedic. I mean, the registered nurses, anything like that, they have the skill set, especially if they're ER nurses, to be an EMT right off the bat, and then a paramedic with very little training. But we don't allow that bridge, and we don't teach in school our responsibility anymore, most schools, to our neighbor. And I said, how did you guys like not get this in school? And one of the teachers said, we don't teach that. And that's sad, because we always used to teach about how would we help our neighbor. David.
The service clubs, they're all struggling. You don't even hear anything about the service clubs. And they were always older members, and they try to survive, and it just goes. My vision of the public safety is it's going to have to change. It's going to have to be a culmination of volunteers, paid, ambulance, cross-trained police. They are always the first to acquire. They can work on the hose or work on the water or hook it up and be cross-trained. That somehow, and I don't want to hear that it's out of job class, whatever, Somehow, it's gotta be a culmination of the whole system, otherwise it's gonna collapse. And, you know, Ogdensburg's facing it with the number of firemen, but if the police are there, get the guys, you know, everyone's gotta tie it together. And then the billing, the ambulances can charge back to the insurance company, why don't the fire insurance company, or the fire trucks? So it's just a culmination, but somehow they gotta cross, they gotta cluster and cross. That's my.
Any other old or new business?
Just a comment.
Yeah.
Large part of the problem with the zooming is if you talk really fast, it doesn't transmit. So Nicole, we'd love to hear from you, but when you get going, when you're about 15 seconds in, you increase your speed and we lose it. It all mixes together. Well, it's the same thing with actually James Button. The auditorial part of it was really difficult to hear. So I think if you speak slower, that is helpful, but it's different sound qualities depending on what you're using for technology in your own house. So I'm disappointed that the extension has gone to April 15th. I think people can be here. And I think Mr. Forsythe, it's better in person, I think, if those individuals that are going to be here, especially if they have a lengthy number of resolutions that they're here.
Any other comments? So do we have the need for executive session?
We do for litigation, personnel, and that deals with the medical, financial, credit, or employment history of a particular person or corporation, or matters leading to the appointment, employment, promotion, demotion, discipline, suspension, dismissal, or removal of a particular person or corporation, negotiation, and appointments from both committees of the appointments.
I have a motion to go to executive session. Mr. Denisha, seconded by Mr. Forsythe. That's it.
Then we motion to adjourn. I motion to adjourn.
And I want to
Joe
ask
second.
one question. Do I have to read this one? No. Oh, board meeting, okay. Then motion to adjourn. Greg, seconded